Good morning, everyone. I think that we will go ahead and get started. I'm Deborah Cohen. I'm director of the Buffett Institute for Global Affairs and a history professor here at Northwestern. And I'm delighted to welcome you to Buffett's Fall Symposium, Abortion Access Today, Global Insights and Comparisons. We're so honored to have 6 distinguished speakers who have come from Colombia, Ireland, Kenya, Poland, and California, and Indiana, to offer insights about their work. Thank you to Caitlin Bernard, Camilla Fitzsimons, Christina Kachpura, Catalina Martinez, Catherine Mayall, and Evelyn Opondo for joining us today. And thank you so much to our Northwestern colleagues, Katie Watson and Sarah Rodriguez, for chairing our sessions this morning. When we decided that abortion would be the topic of our fall symposium last spring, we were of course influenced by contemporary events. We wanted to understand the ways in which what's happening in the US, viewed comparatively, is anomalous. As the Center for Reproductive Rights has demonstrated, around the world, access to abortion has in fact widened considerably. Since 1994, more than 60 countries have liberalized their abortion laws, with a pace of change accelerating over the past 5 years. Last March, France became the first country to constitutionalize the right to abortion in the national constitution. And right now, 35% of women of reproductive age live in countries that allow abortion on request with varying gestational limits. During that same period, since 1993-94, only 4 countries have taken steps to remove legal grounds for abortion: the United States, El Salvador, Nicaragua, and Poland. We also wanted to have a forum in which we could think about abortion not just as a question of healthcare or gender equality, themselves very important issues, but also as a question of foreign policy, even geopolitics. Reproduction has long had an international history. It is from the entwinement of birth control with eugenically oriented population control to the restrictions that the Helms Amendment of 1973 imposed upon abortion care overseas, to the global gag rule, the so-called global gag rule that has prohibited foreign NGOs from using any funds, including non-US funds, to provide information about abortion. But more recently, it's become clear that the rollback of abortion rights, like attacks on gay and transgender rights, are one key indicator to the weakening of democracies around the world. These are transnational movements exporting strategies and influence campaigns overseas, across national borders. But if the restrictions on abortion rights are an international movement, so too are the forces of liberalization. And indeed, it's possible now to talk about an entire international ecology of abortion, where pills for medication abortion circulate across borders, where often undetected telehealth appointments allow doctors and nurses to manage an abortion in another country, but also, as I said, where anti-abortion campaigns use the same playbook to essentially work across borders as part of a campaign of authoritarianism. Abortion is, of course, part of a much broader set of concerns around reproductive health, including access to birth control, access to maternal mortality, access to maternal care, attempts to prevent maternal mortality, environmental justice and reproductive health, among other issues. To focus our day-long conversation on abortion, we're kind of keeping our attention on abortion, though all of these other issues about contraception and reproductive health and reproductive rights will undoubtedly emerge in our conversations. Thank you to Foreign Policy Magazine, represented by Angeli Huani, who is with us today. FP has produced a really helpful insight brief and will also publish a synthesis report from our conference today. I want to thank Samantha Nissen, who's in the back there, Buffett's Director of Strategic Initiatives and Undergraduate Programs, and May Malone, who is also in the back, Buffett's Director of Communications and Outreach, whose insights have both been really crucial to the program that you will hear today. We are super fortunate to have them at the Buffett Institute. So, on to the first panel. We have asked our panelists in this first panel, which is about declining access to abortion, to talk about the circumstances that have led to this state of affairs, and if relevant, the international dimensions, to provide their own personal thoughts on where things are headed and what the strategies might be. Our colleague, Katie Watson, will be moderating this first panel. She'll briefly introduce our speakers whose bios are in your folder, but let me briefly introduce her first. Katie Watson is a professor at the Feinberg School of Medicine at Northwestern. She teaches medical ethics, humanities, and the law. A lawyer by training, she has served as senior counsel for the ACLU Illinois Women and Reproductive Rights Project. She's author of the book, Scarlet A, The Ethics, Law, and Politics of Ordinary Abortion, published in 2018, which the New York Times described both as respectful and as revolutionary. Thank you all for joining us for the symposium today.
I want to introduce each panelist just with a sentence, and as you heard, there's paragraphs in here. We'll hear 10 minutes from each. I'd like to ask them a few questions, synthesizing their comments, and then we're going to open it up to the room and have a conversation with everyone here. And there are folks on Zoom, and we might be able to take some Zoom questions, I believe. Okay, so we'll see how we can integrate all of that in our 90 minutes. I first want to introduce you to Krystyna Kacpura, who has joined us from Poland and who leads a Polish group fighting for abortion access, as well as being the president of the Central and Eastern European Women's Network for Sexual and Reproductive Health and Rights. It's going to give us the Polish and European perspective. Dr. Caitlin Bernard is here from Indiana to focus on the domestic perspective in banned states and, of course, across the interaction across states like Illinois. And Katie Mayhall is a human rights lawyer specializing in global abortion access at the Center for Reproductive Rights to contextualize this morning's focus on the retraction of abortion rights and access globally for us. And then this afternoon, we're going to talk about expansion. So, Krystyna, we've chosen to go by first names. Would you start us off with your 10 minutes to give us the Polish perspective,
Can I
please?
stand up?
Please do. Yeah.
Good morning. I'm Krystyna Kacpura. I came from Poland, and as it was told, I'm the president of the Foundation for Women and Family Planning, the oldest SRHR organization in Poland, the first one which was established in 1993. I have been working there for 30 years, so it's a long way. We made one step forward, two back, and it's the same right now. But just would like to tell you not about the history right now, but about the future and about the present time. Polish women won election. We organized a huge campaign to encourage them to vote. And you know what happened? 76% of women voted in last election last year. Previously, it was around 68, 67%, and more women voted than men. We won this election. The Democratic Coalition ruled Poland right now, but it's not so easy to change the very, very draconian abortion law in Poland. Could you imagine the country in the center of Europe when women are dying because of the lack of access to safe abortion procedure? The country, the democratic country, well-developed and economically, country of well-educated people, but still women are dying. Right now, we delivered 3 draft laws to our parliament. And for the first time in the 30 years old history of anti-abortion law in Poland, these progressive draft laws were not rejected by Parliament after the first reading. And a special committee on abortion law was established within the Parliament. My organization is a member of this committee, and we work. But it's time to stop the work and discuss the issue. This is the health issue, and we should change the law and help suffering women as soon as possible. I think my time is over.
You have more time if you like.
Okay, I don't want to.
I'll let you know.
Yeah. This is many occasions to talk about abortion issues. After 30 years, I have just quite enough the discussions, the thinking, what to do, how long will we be waiting for changing the law, what are women owe to the government, because abortion is a political problem, and we don't want to regard the abortion as a politics. This is the privacy, this is the health issue, and this is the well-being of women. So don't touch abortion politicians, and don't make this the political issue. This probably happened in other countries, but in our country, in Poland, abortion is really a political issue. Over 30 years ago, they introduced the anti-abortion law, which was called the compromise. This was the compromise between ruling party and Polish Catholic Church without the participation of women. Abortion was allowed only in 3 narrow cases on paper, but in practice, it was almost a total ban of abortion because of misuse of conscientious clause, for example. Thank you very much.
Thank you. Yeah, I'm okay to sit if that's okay with you. I really appreciate that perspective. We were just talking a moment ago about thinking about working on something maybe even your entire life, and not seeing, for example, for us, the progress that we hope to see. My career has been much shorter, but it's very difficult to think about what this is going to look like for the next 20, 30, maybe even my entire lifetime. I think most people here know a little bit about the history of abortion in the US, so maybe I'll just give a little bit more of a perspective from a physician, and kind of the ideas of the way that access to abortion has changed. Thinking about pre-Roe versus Wade, we know that there was many abortions being performed in sometimes safe ways, right? Physicians talk about the way that they were called to that work, even when it was criminal, and providing it in the safest way that they knew how to at that time. Obviously, lots of unsafe abortions as well were performed, and we know that the rate of death and maternal mortality due to unsafe abortion, as well as lack of access to abortion, was incredibly high. Thinking about the implementation of Roe versus Wade, we saw obviously incredible increase in the safety of abortion and access to abortion, and yet continued to see the same lack of access in many states, right? We began this patchwork where in many places implementation was unavailable due to conscientious refusal, as well as really the siloing of abortion care into outpatient clinics like Planned Parenthoods, which allowed a separation from medicine, right? This idea that abortion is not normal part of OBGYN care, that abortionists perform abortion, and really allowed for the harassment and targeting and murder of abortion providers, because they weren't just OBGYNs, they were abortionists. And for a long time, there was a lot of apathy You could go to Planned Parenthood and get your abortion. There was no problem. There's nothing to fight for. And at the same time, laws were being implemented year after year after year in many states, even those that we would consider, blue states, that were decreasing that access and making it more and more impossible for physicians to provide that care, more and more impossible for it to be located within normal part of healthcare, further siloing that care, and making the restrictions impossible for people to be able to access. So we see increases in waiting periods, decreases in clinic availability, physicians providing abortions, gestational age bans that really allowed people to say, well, you can get an abortion, but only if all of these things that made it practically impossible. So for example, this idea of the compromise, this idea of, reverse Roe, back, bring back Roe, for those of us who provide abortion, we know that that was never enough, that the people who were unable to access abortion under Roe were so many, and the consequences of that lack of access so great that is an untenable compromise for any physician and most people who understand what that looked like to go back to. That being said, certainly Dobbs' decision came down in a way that was absolutely devastating, and that we're still trying to figure out how to provide care. In many states, trigger bans were enacted. In Indiana, we did not have a trigger ban, but we later that summer had a special session that was brought by the governor. This was expected and known. We worked very hard with them to negotiate that, which I think, again, comes down to this idea of where does the compromise begin and where does the 1,000 cuts, the death by 1,000 cuts begin. Physicians in many places feel complicit in that we, negotiated to, for example, have an exception for rape, but only to 12 weeks. That we negotiated an exception to things like health and life of the mother, but still knowing that those would be used against us, as we have seen throughout the country. Then it becomes the fault of the physician. If you hear reports of women dying because they did not have access to abortion, because there's a health or life exception, then the doctor must not have acted fast enough. The doctor didn't interpret the law correctly. They could have had an abortion if only the doctor had done their job. And so it really creates this system where doctors have always been the target of the harassment and the violence, and now are the target and harassment legally, so that we're in a catch-22 where we can't provide abortion, but we can't not provide abortion either. Not just in a legal way, but certainly in an ethical, moral, the moral, kind of harm that is being done to physicians around the country is really devastating. And so certainly we're seeing the effects, for example, on lack of access to abortion in banned states, but also lack of access to general OBGYN care. And so you're putting, not just physicians in a catch-22, but women in general. Either they try to get an abortion or they try to continue the pregnancy. Either way, it's unsafe, and they're going to face lack of access to care for that pregnancy as well. We see that certainly the most recent case when thinking about are women dying, right? And so, this question comes, what is the real harms of an abortion ban? We're decreasing abortions. That's purportedly the goal, but then are people being harmed by them? And certainly we see, for example, closures, particularly in northern Indiana, in rural areas right around the country, lack of access to regular OBGYN care, as you alluded to in the introduction. So women dying, for example, of ectopic pregnancy that could be completely preventable, but lack of OBGYN care, lack of hospitals that provide that care. And then the question becomes, is that due to the ban, or is that, again, the doctor's fault, right? We're leaving states where bans are because we can't practice, we can't absorb the moral injury, and yet it's our fault that we're leaving women without care across the country. So certainly from a physician perspective, the bans are incredibly harmful to our practice in general. And I think certainly when we look at what are the trends now, we're looking at people, this patchwork and really kind of like changing by the day, right? When we're discussing, for example, the changes in the laws in Georgia, on one day it's in effect, on the next it's not, on the next it is again. So trying, desperately to figure out how people can get care, and this, new role of physicians, right? Never in our history have we had to try to coordinate care for people across state lines, trying to figure out how and where they can get care depending on a law that changes every other day. So I think where we are looking at, that's the reality currently. What we're looking at in the future, of course, is going to depend so much on the upcoming election. Somebody was asking, are you expecting any changes in Indiana? The answer is no, right? We have supermajority of Republicans in the legislature. As you said, this has become a political issue, a political campaign, and without a change in our state government, without a change in our governor, all of which we expect to be Republican for the foreseeable future, if anything, that there will be a tightening on restrictions. An idea, again, these physicians must be performing abortions that are illegal. When they look at, yes, abortions are still being performed for the exceptions. Well, are they doing it right? How do we monitor, physicians who must be trying to skirt around the law, and how that care is under the microscope in a way that will lead to me going to jail, essentially losing my medical license. And so how can you, bring more physicians into a state where that is the case? That's probably close to time.
Thank you.
Thank you so much. So I'm going to sort of step us back a little bit and provide a bit more of the global context. So as we heard in the opening remarks, more than 60 countries have liberalized their abortion laws over the past 30 years, while only 4 countries have removed legal grounds for abortion. But at the same time, I think looking at the legality of abortion really is just a subset of the issue of thinking about abortion access and even abortion more generally. Abortion still remains in the criminal code in almost every single country across the globe. So even countries that we think of as leaders on abortion access, like France, which just embedded the right to abortion into its constitution, still has abortion embedded in its criminal code if people don't follow the proper procedures and do things like have a provider administer abortion care to them. So I think in just thinking about abortion globally, it's important just to think about how distinct abortion is as a form of healthcare, as the only form of healthcare that still lives in criminal codes. Importantly, even beyond where abortion specifically lives in criminal codes, at the Center for Reproductive Rights, where I work, we also see people criminalized for things like obstetric emergencies. Catalina is going to speak a little bit later, but Catalina has litigated a really groundbreaking case before the Inter-American Court of Human Rights about a woman who suffered an obstetric emergency during her pregnancy and then was sentenced to 40 years in jail in El Salvador for an alleged illegal abortion, but she was charged under the homicide statute. But I think when we think about things like criminalization for obstetric emergencies, I want to also make clear that this isn't just countries outside of the US, that we also see this happening within the US. We saw this pre-Dobbs within the US, and we continue to see it here as well. Another important dimension to this is also thinking about, of course, the advent of medication abortion has made self-managed abortion much safer. The World Health Organization recognizes that people can safely self-manage abortion using medication abortion pills during the first 12 weeks of pregnancy, meaning, as we hear about people ordering abortion pills online, or in the US context, I think more so using telemed to access abortion from a provider in a state with more progressive abortion laws. Nonetheless, self-managed abortion, similar to how abortion generally remains criminalized, is also, sort of doubly criminalized across the globe. We recently just did a study on 39 predominantly progressive jurisdictions where a lot of the countries we looked at were countries that are considered leaders in abortion access. And yet 90% of those countries still mandate some form of provider involvement in abortion care, even though the World Health Organization says that that's not actually necessary if you're using medication abortion in the first 12 weeks and if you have access to quality pills and the right information. All of the countries we surveyed also require prescription for medication abortion, and half of them still have in-person or facility-based requirements for medication abortion care, even though, once again, the WHO says that that's unnecessary and actually is a barrier to access. I also want to note, as we're thinking about abortion across the globe, we spoke about this a bit yesterday at a smaller conversation we had with students. Also, just that abortion rights are importantly about gender equality and about sexual and reproductive health and rights, but they are also a key marker of democracy. In US states with restrictive abortion laws, we also see considerable efforts around voter suppression. We see heavily gerrymandered states where actually electing a state legislature that reflects the population of that state's will and desires around the laws is simply impossible. And we heard yesterday about a bit about Nicaragua, where there's been a blanket ban on abortion since 2006, and where actually in many ways, in retrospect, this was a bit of a canary in the coal mine about rising authoritarianism in that country, which is now a country where civil society can essentially only operate underground and has essentially ceased to be able to exist out in the public. But also just to note that even if abortion was unpopular, which it's not, that's just not the whole point of how we think about fundamental rights and how people exercise individual liberties. In other contexts, we don't let the will of the people suppress an individual's right to make decisions about their bodies and about their bodily autonomy in the way we do around abortion across the globe. Okay, good. A few other things. So we've talked a little bit about I'm going to skip that part, actually. Okay. I want to just note a little bit about US exceptionalism also in the abortion context, and just how distinct and how truly strange the US is when we think about abortion and abortion access. So first and foremost, when we think about peer nations or high-income countries, the lack of a universal healthcare system in the US is just incredibly distinct. We are almost fully reliant on private providers for our healthcare. And in most high-income countries, people simply don't pay out of pocket for health services. There's no such thing as a deductible. Everybody has some form of healthcare they rely on. My colleagues and who are here from other countries can speak to the fact that you would never pay something like $300 or $400 or $500 for abortion care. That, in fact, I think a colleague in Belgium recently told me that you would maybe pay $10 at the clinic as a sort of copay type of model. Additionally, in contrast to other high-income countries and even middle-income countries across the globe, the US is the only high-income country without any paid parental leave, even though 13 US states have passed paid leave laws. And a colleague of mine from Ireland yesterday mentioned that she took a year off after the birth of each of her children, which I think to all of us in the US is truly unimaginable. Additionally, the cost of childcare in the US is exorbitant. I saw a study recently that rich countries contribute an average of $14,000 per year to pay for a child's healthcare, whereas if we look at what the US government puts into children's healthcare each year, it's about $500. So whereas I pay $1,800 a month for my 2-year-old to go to daycare every day, a colleague in Germany recently told me she pays a $60 fee every month for materials and lunches. And then additionally, just to mention the legal restrictions within the US, the Hyde Amendment prevents the US government from paying for abortion care except for in very minimal circumstances. The Helms Amendment prevents us from using any foreign aid relate to abortion care. And then of course, the global gag rule, if reinstated, would prevent folks or organizations that receive USAID money from using even their own money for abortion access or to promote abortion. And finally, the last way that I will just note as a human rights lawyer that the US is truly distinct is our refusal to ratify any international human rights treaties. We have ratified probably the fewest international human rights treaties globally. We are the only country that has not ratified the Convention on the Rights of the Child. We've, of course, only signed but not ratified CEDAW. And even where we have ratified those treaties, we tend to see them as generally optional and unenforceable in practice. I'll stop there.
Thank you. Wonderful. Thank you for that range of rich perspectives. I guess I want to start with this idea of abortion being political. And I both hear exhortations to, we have to be part of the political process. Women increased the vote. I understand in Poland, you only lost by 3 votes in the lower house of the parliament, an abortion rights bill. And so the idea that it's a political process that grants rights. And at the same time, I hear calls for like abortion should not be political, it should be private. And I struggle with the tension between those, and maybe it's a temporal thing, maybe it's a both and, but I think about the civil rights movement in the United States, to me saying like, well, lunch counters shouldn't be political, it's just a place to have lunch, except it's not, it represents equal treatment or equality in the social realm. So how much of this is really about are women people, and that is a political question, and so we can't avoid it, and how much of it really is like, if we could just stop talking about it and have it be private, everything would be fine. Can you help us wrestle with the idea of abortion being political and what our goals should be conceptually?
It's not easy to answer for this question, but you know, as it concerns Poland, it was political from the very beginning. From early 90s when we regained democracy after the economic transformation. And first, it was a political battle between politicians and the Polish Catholic Church, because the church was involved very deeply during the solidarity movement in Poland. And when we regained democracy, the church wanted to be useful and wanted to be at the top of the politics. So the first issue was abortion. We regained democracy, but Polish women paid for this democracy, for this economic transformation. We paid with our rights. Right now, during the past 30 years, there were many attempts from both sides, because this abortion law called compromise between politicians and Polish Catholic Church, this was not enough for both sides. So democratic and women's movements, they wanted to liberalize the law. And other side, fundamentalists, they wanted to introduce the total ban of abortion. And every year, from both sides, civic initiatives draft the law and deliver this to the parliament. And every year it was both drafts law were rejected after the first reading. And it changed when women started to vote. When we won the last election, the very liberal law was not rejected after the first reading, but sent for further proceeding to committee. How it happened? For 30 years, Polish politicians were sure that they will not make any political career without the support of the church. That everything depends on church. But right now, the role of the church was minimalized because of pedophilia, because of many crimes, and people discovered that this is not the church they want to have. This is not this kind of faith. Over 50% of students and pupils don't attend the religion lesson. It minimalized during last years. But still, politicians want to criminalize abortion and want to make the law much more restrictive. It was 8 years ago when one party won election and was able to build government solely and had majority in the parliament. And first issue they introduced were women's rights. They limited access to emergency contraception, access to hormonal, all kinds of modern contraceptive methods, sexuality education, everything. Sex educators were not allowed to enter public schools. And it lasted 8 years. It was really the horrible time, because during this time, they also introduced a draconian draft law on a total ban of abortion. This was also a civic initiative of the organization called Ordo Juris in Poland, very, very strong one, supported by the US fundamentalists. We know about this, and they told us as well. And this was the law which was one step too far for Polish women, because it was total ban of abortion, no any kind of contraception, rejection of emergency contraception, which was called by them early abortion pill. Of course, this is not the truth. No prenatal tests for women, only in case, they were allowed only in case when it could serve so-called by them unborn child. So if a gynecologist saw that the fetus has had very serious impairments, they didn't allow to have prenatal tests. Only when it was possible to give a treatment to the fetus before the birth giving. And, you know, together with this draft law, we also collected signature under the civic initiative, and it was a very liberal law, abortion up to 12 weeks of pregnancy, of course, sexuality education and all modern contraceptive method. And both drafts law were discussed during the same parliament meeting. And our was rejected after the first reading, this progressive one. And this very, very sharp draft law was sent for further proceedings to parliamentary committees. And as I said, it was too much for Polish women. We came into streets. So we are standing 2 days in pouring rain, blocking metro stations, crossroads, train, buses, everything. And after these 2 days, the parliament came again. There was a special meeting of the, not in a program, parliament, and they rejected this draconian draft law. For the first time, they made a step back. Never again. It was this, we won the battle, of course, but still a huge war is ahead of us. It's not the end. I think that especially, the society and the politicians should know that they were elected by people and they have to serve people, not to serve their individual beliefs or ideology. The law should be for everybody, not for the group of people, not for the Catholics only, but you have right to have a law which is for you, not based on the individual's ideology. And right now, we spoke to every individual members of parliament just to tell them the truth. How does it look in the real life? What does it mean for women? And according to latest researchers poll, around 70% of Polish people are for the abortion up to 12 weeks of pregnancy. And among these, over 80%, 82 or 3, are for abortion. There are young people, 18, 30 years old. So this is a curiosity, because this is the generation which have not, who had only religion, not any kind of sexuality education, but they are traveling, they know other Western countries. And this is strange for them that abortion as a healthcare is so limited in Poland and so stigmatized. This is unbelievable for this young generation. And I'm happy to see that during marches, demonstrations, there are so many young people, not only girls, but also boys. And this is really important that the society as a whole finally understood that access to legal and safe abortion is their issue, not only women, but the whole families and the society.
Please.
I was just going to give from a physician example. I have friends that practice in Canada, and they have no laws about abortions, neither allowing nor restricting. They have lots of difficulties in providing that, distance, rural areas, lack of physicians who provide institutional policies, all of which are much, much easier to change than a law. And so personally, I think no law is better than any law.
I think maybe to build on what Caitlin just said, or Dr. Bernard just said, just to add that I think also, the idea of getting the laws off of our bodies is actually just a preliminary first step in my mind. There's actually so much more we could be asking the government to do to promote abortion access that I don't want to get lost in it as well. I imagine a world where there's proactive, affirmative laws recognizing abortion as a right, as a human right that individuals have, where the government allocates funds towards abortion care, where medication abortion is as easy to access as getting a Diet Coke out of a vending machine. And so I think I like to dream big about a world where it just looks completely different.
It's interesting because thinking about politics as a proxy for just power, that no law actually requires a lot of political power, right? That's not the absence of law, that's a deliberate choice. It is the absence of law, but it's a legal choice. Or an affirmative law from a reproductive justice initiative or standpoint to say no, an affirmative right that then comes with benefits, right? But that idea of, do you have the political power to keep things private is a struggle. Caitlin, you mentioned, the idea of going back to Roe because access, obviously, it's not and I think people who are new to this issue sometimes are still learning that it wasn't like everything was great in 2021 and then it got bad in 2022. When you say you don't want to go back to Roe and you were referring to all those restrictions, just for the folks in the room who don't have the cases lined up, Roe in 73, of course, developed the fundamental right to abortion, which when you read it, it's a physician's right to perform an abortion and a woman's right to beg. It's really not framed as a woman's right. But then Casey in 92 allowed the flood of the regulations that you were referring to in terms of the restrictions. Did you mean to say you don't want to go back to Casey, or do you mean you would go back, and I just want for clarification in the current presidential debates about a federal codifying Roe, would you want to codify Roe with its viability standard and its exceptions, or go to this no regulation or just a positive right? This is between pregnant people and their doctors. And Katie as well, thinking globally and locally.
Yeah, I think it's really clear that any law creates a precedent that can be built upon either in positive or in negative ways, but tends to be in negative ways, particularly in the US. And so, for example, creating this framework of gestational duration as the end all and be all of when, a fetus becomes a person, and therefore the person whose body is being affected somehow gives up all of their rights is untenable. We know that later abortion happens. We know that it's necessary, and that, this idea that we'll compromise to create a gestational duration limit, which has no medical benefit and is frankly a political tool, is not something that we can ever give into. And I think, we, as my mentors have said, for those of us who work in banned states, Dobbs was devastating, but it is also an opportunity to dream big, to see a new opportunity for us to reshape the way that abortion should be thought of, which is purely a decision between your physician and yourself and your family, no matter how far along you are in the pregnancy, no matter the circumstances that bring you to that medical need. It's a medical procedure and should be squarely within that realm and completely taken out of politics and law altogether.
I think just to add on that, another way the U.S. is truly distinct is the way that our Constitution is built around civil liberties and not on economic, social, and cultural rights. So even with Roe establishing that people can access abortion or can legally have an abortion, there still are no actual protections to your right to access any form of healthcare within the U.S., certainly not under our Constitution as it's currently being interpreted. And so I think that one is one way where there really is a need for proactive legislation that really affirms this as a right. I mean, I would go beyond abortion care, because I think if we're thinking through a reproductive justice framework, it's important not to just focus on abortion, but to also think about the fact that the lack of a right to equitable access to healthcare in the U.S. has disproportionate effects for marginalized and underserved populations in their maternal health care as well, and across the full spectrum of their sexual and reproductive health and rights.
Well, this sort of gets us to another framing question about abortion as a medical issue. We heard Katie talk about like the WHO saying with medication abortion and the dream of a vending machine where there's Diet Coke and then medication abortion. And Caitlin, you just used the term like between a woman and her physician and family. Is deciding whether to continue a pregnancy, do I want to have a child now or ever or not, a medical decision? Like how much have we centered clinicians, physicians, and medicine as a social status cloak for saying those pregnant people can't just make their own decisions and then go get the medical means to continue or end the pregnancy? Is abortion a medical decision?
I guess I would argue that the right way to look at it is how the individual looks at it, right? So even as we think about access to self-managed abortion, a lot of people prefer to have a provider. A lot of people prefer a procedural abortion over a medication abortion for a whole host of reasons. A lot of people, even if they are self-managing at home, want to have a provider they can text to guide them through it. A lot of people, though, have also faced grave human rights violations within the healthcare system and have good cause to be wary of provider involvement. And I think it's important to both value both of those experiences. Or I think young people also just feel a bit more comfortable with self-care generally and with the ability they've had access to the internet their whole life. They know how to look up. Sometimes they know when and how to seek care and they feel comfortable making that judgment call. I think more so than many of us who have, where the formal healthcare system has been our conduit for healthcare our entire lives. So I think there's also just differences in the evolution of that too.
Yeah, as a physician, I mean, I think a lot about abortion as a public health issue. And I think in that realm, for me, safety of abortion is of the utmost priority. And the challenge, it has took me a long time to come around to self-managed abortion, as I think is pretty common within physicians, and still there's a lot of hesitation to that, particularly because, when you think about other things that have been taken out of the healthcare system and whether that ends up actually serving people or not, particularly when we think about the shortfalls that physicians, if we can improve the care that we're providing such that we are the place for that safe access to occur, then that to me is the ideal. If our shortfalls exist such that people feel that they need to go outside of the healthcare system, then we're not doing something right.
Interesting. Christina, can you help? I want to talk about resistance and movement and medication abortion, all these things. So in the United States, I think many people were surprised in the first year after Dobbs to see that the number of abortions in the US actually went up by several hundred. Again, to Caitlin's point, it doesn't mean that the right number was the year before Dobbs, right? Like people still were denied access, but we're surprised that there wasn't a dramatic decrease. And in Europe, I understand that Poland, as you said, is an outlier. Can you first educate us about the European context in terms of the laws of the countries around you and where, how many Polish women are able to travel to the degree you have data or your own Gestalt understanding or receive medication abortion, how the law matters so much, and at the same time, how interestingly in this moment of internet access, medication access, and the right to travel, it doesn't completely control everybody. So can you help contextualize that in Europe? And then we'll talk about the United States and what access looks like even with bans.
Okay. The very restrictive law doesn't mean that there is no access to abortion, especially in time of medical abortion. So I would like to tell you about the time of pandemic of COVID, and then time when when 5 million of Ukrainian refugees came to Poland, and mainly women. We have many grassroots organizations, the small one, which provide women with abortion pills. They contact organization from Netherlands mainly and order this pill. This is not criminalized. Women in Poland still are not criminalized, only so-called helpers and gynecologists. So every single woman can order pills. Of course, there are many places, and some of them are false. That is our duty to inform women what sources are legal and what sources are good for them to provide with abortion pills. This is not so easy because during pandemic, sending pills took time. And sometimes it happened that a woman took pills very late, in 16, even 18 week of pregnancy. And she required medical help, but she was afraid to go to hospital. She was afraid questions, even if legally she wouldn't be criminalized. But gynecologists, they made such terrible and horrible atmosphere for women that every single case, they were threatened by gynecologists. I will go to prosecutor. The prosecutor will ask you. And you know, women didn't know, and still they don't know, that they are not criminalized, even if we share very broadly this information. So my organization established a network of so-called friendly gynecologists, and every case of late medical abortion, we directed to these hospitals. Honestly speaking, we saved life of many women, because sometimes it happened that they use very, very late medical abortion pills, and they really required medical help. This is the one side of the issue. The second is Ukrainian refugees. When women from Ukraine came to Poland, they didn't expect such draconian draft law. They were draconian abortion law. They were informed close to the border by fundamentalists that abortion kills more people than the war. And the abortion is forbidden. It's killing a baby, unborn baby, and something like this. So they were afraid. Many of them were raped. And after a month or a couple of weeks, they found out that they are pregnant. How we could help them? So from the very beginning, we established a special urgent hotline for refugees from Ukraine with names of gynecologists, with contacts to them, with the sources of abortion pills. This was the kind of activity, this activity was the very thin line between this, what is legal, what is illegal. But still sharing information is legal in Poland. So we just said that we share information. Of course, we help many people secretly, many young women raped, especially with wounded and traveling many hours standing at the front and the border without, just simply water, everything. So we help them at the border, very close to the border. We have our point, our special place with gynecologists. It wasn't easy, because even if pregnancy resulted from rape in Poland is legal, the procedure is really very, very complicated. It is up to 12 weeks first, then you are sent to a prosecutor or police station. You have to present witness or something like this. And how could these Ukrainian women present and tell who it was, this Russian soldier? She didn't see him. So these abortions were provided by Polish hospitals secretly, because they were against the law, with our help, and during the night, women came out of hospital. So it was our help. Right now, these grassroots organizations provide women with medical abortion. We, as a first organization, we deliver them the special short brochure, how to use this and what could happen, and when she should go to hospital and ask, and don't afraid to go to hospital, because women are not criminalized. And according to their statistics, every day 150 Polish women use medical abortion. Every day, every single day. Additionally, right now, we have access to hospitals in case of difficult pregnancy. It is our small victory because according to our procedure, which were delivered to the Ministry of Health, mental health is regarded as the situation when the abortion can be legal and performed in hospital. So again, build a group of friendly psychiatrists who consult women and then issue a statement that this pregnancy shouldn't be continued because of the threat to a woman's mental health. So it's needed right now only one certificate, one psychiatrist, and one gynecologist to decide. Especially these difficult abortion with fetal abnormalities. Earlier, it was extremely difficult because every Polish hospital, public hospital, had different procedure. They require 2 certificates from 2 different psychiatrists. They require consilium. They require the professor opinion, at least 3 gynecologists, and prolong this. Finally, it was too late for making abortion. Thank you.
Oh, I just think it's interesting to think about the mental health as opposed to in Poland. In Indiana, there's actually a specific section in the law that explains that mental health is not in fact health and specifically excludes us from providing abortion in cases of mental health. It's just interesting to hear the differences.
Yeah.
I think to build on what Caitlin just said, actually, when you look at the global context, there are, a number of countries, maybe 40 countries that have abortion laws with health exceptions. Only 2 of those countries specify that mental health does not count. So just to show how distinct the US is, to be explicitly including mental health is really against the norm of what we would see globally, even for countries with restrictive abortion laws.
It's fascinating. Well, and we haven't addressed the numbers in the US, but maybe we can tie this. I have a million questions, but this will be the last I'll ask now, and then I'm going to invite the audience to share their thoughts and questions. But I want to think about, personally, I would never say like, oh, Dobbs was a good thing, right? There was no good, but the lemonade or the change I see is people who were maybe supporters of abortion rights, but never said that out loud, have realized that silence is a luxury they can no longer afford, we can no longer afford, and it's galvanized people. So I want to talk about in both the Polish context and the US context, what resistance looks like, how it arises, how it galvanizes, how it manifests, and Caitlin, you've worked in a state that's been tough, like as you said before, you could hardly get an abortion in Indiana. It was very difficult before Dobbs. The changes you've seen in terms of people saying no, and here in Poland, after it sounds like 30 years of this, women rising up and saying no more, not doing this anymore, right? What resistance looks like globally, locally, and how we can capture that even in restrictive and take the every crisis is an opportunity kind of mentality. How do you leverage that to move to a freer future?
I think I can start. I think, this ties to what I had said about the connection between abortion and democracy earlier. But actually, every state in the US that has put abortion rights on the ballot, abortion rights have won overwhelmingly. And so I think that's important context for thinking about what resistance looks like. Certainly voting, there are a handful of ban states where referendums on abortion are not a legal option, that the state doesn't use a referendum type model. And so where that won't be an avenue for potential reform. But I think voting, absolutely. And I think also we've heard in the work that we do globally, even some of the cases that we bring around abortion that might be the first piece of litigation ever in a country that's about abortion rights or abortion access. So I think even just thinking about the socialization of abortion as a right, as a form of healthcare, as something that people need for a lot of the contexts we work in is actually, it's still something that's so heavily stigmatized, and in a lot of parts of the US, something so heavily stigmatized that it's not even part of the conversation. So I think also thinking about resistance as openly talking about abortion care, talking about for folks who have this experience or friends who have this experience where they're comfortable, making sure that you're having these difficult conversations as well.
Yeah, I think, certainly for physicians, it's really galvanized the rise of physician advocacy, and that's not just around abortion, but also things like gender affirming care, as we realize, again, that siloing that happened before really put, OBGYNs who provide abortion or people who provide abortion on an island. And now I think it's really made people realize that that is not the case, that potentially we're all at risk in our practices, in the intrusion into the physician-patient relationship, into the decision-making for what care is appropriate, evidence-based care in general. COVID, the same thing happened, for physicians in ICUs and, all of the people affected by that. So I think the rise of physician advocacy has been the biggest resistance that we've seen. The other is really storytelling, really highlighting aspects of care in a really public way, something that has been, abortion stories have been in the shadows for a long time, and making sure that people are able to understand why and when abortion is necessary, and the harms of abortion bans. I think it'll be really interesting to see in our election whether that information translates to changing votes.
I'm so sorry. I need to build on something that Caitlin just said, because I think we haven't talked about gender affirming care, but I actually think as we think about resistance, thinking about the linkages between attacks on gender affirming care and attacks on abortion rights is incredibly important. And I think often people think of this as, being abortion rights activists, we see a lot of women being active around abortion rights, but the importance of preserving access to gender affirming care at the same time is incredibly important. Also thinking about attacks on gender affirming care, particularly for adolescents and youth, is also attacks on abortion rights when we think about what the scope of the law is and the way that the law gets to control individuals' bodies. So I want to just emphasize that point of Caitlin's.
I think that it's the most important is to raise public awareness about the importance of maybe not rights. It's not understandable for the society as a whole. Importance of the women's health, for the family, for the well-being of them. Just to translate them in a simple language. The resistance in Poland is very huge and very strong one. It is contact not only the society, it is approached not only to the society, but also to medical staff. Because medical staff was used, still is used to treat patients with a kind of, as somebody who is, especially women, pregnant women, as the patient in difficult situation, but it's also difficult for them somehow. They were not punished if they refused legal abortion, but still they are punished if they perform illegal abortion. And it's, also depends on the law, of the explanation of the law. It can be read in many ways. So our lawyers organize special panels and discussions almost in every hospital to show them how does law look like, what we can do, what is forbidden, what is not forbidden. And it makes them that they are right now more open to patients, to women, to pregnant women, and don't require additional certificates and additional tests. But it's still a long way, especially for young gynecologists. There is only 2 hours on abortion during a medical studies in Poland. 2 hours. So we also have to educate them on medical procedure, on modern abortion, not only, on the law, what is allowed by the law, but they know nothing about medical abortion. We know more.
It's a powerful illustration of the relationship between culture change, and there's medical culture change, layperson culture change in the storytelling, and legal change, and that it's not unidirectional, right? It's a tornado where each informs the other. Bad analogy this week. So I would like to open it to the audience. I'm sure you have so many things and it's such a rare opportunity to have these three rock stars together. So let's start. I see a hand here, and there's someone coming with a microphone so our folks on Zoom can hear everything.
Thank you so much. My name is Mary. I'm also from Poland, so it's really great. Thank you to all the panelists. It's been really a great discussion. I wanted to ask about the next steps. We have some kind of commonalities between the US and Poland, where the legislative process recently has made it really difficult to make abortion not only available and accessible, but also an enshrined right that we have. In Poland, the PSL party has strayed away from the coalition, making it unable for abortion to pass in the lower house. And the Supreme Court has made it impossible for abortion to be a right, overturning Roe. What are the next steps when such blockages are faced? What has to happen so that we can make this a reality for us?
There are many different, scenarios for the next steps. First of all, I think next month, the draft law on decriminalization of abortion will be introduced for the second time. What about the peasant party, PSL, as you told? It's a difficult situation because they voted against the decriminalization of law, but when they came back to their native cities, they were strongly criticized by their voters, by people. So right now, they keep silent. We will see what will happen because, the society is against the criminalization, is against the restrictive law on abortion. And I don't know, as I said before, this is their ideology and their religion, not their voters. So we explained them that, what does it mean? Law is only the law. Law allows you, but law doesn't force you to do. If you don't accept abortion, so just don't do this.
Don't have one.
Don't have one.
Great
Yes.
policy.
Yeah. And next step, we are waiting for the election, for the presidential election, because right now, without the signature of the president, nothing will change. So we made some small changes. First of all, mental health. It was introduced as a rule by the Ministry of Health, and this information was resent to all Polish hospitals. So right now, it's according to the law. It's allowed. It's extremely important. The fight has been lasted 4 years to include by us mental health. We show the examples of women who suffered mentally. They agreed to write their stories, and we show these stories to the members of parliament, especially when Constitutional Tribunal excluded abortion in case of fetal impairment. The sentence was that this is not constitutional, it's anti-constitutional, and this beat women in extremely difficult situation because over 99% of legal abortions in Poland were performed in case of fetal impairments. So they were women in the hospitals, they were women after the prenatal tests, they were women who were waiting for the result when this sentence was announced. And these staying in hospital were told to go out because we have a new law. So gynecologists, instead of contacting Ministry of Health or maybe parliamentary commission or something, they just called us. They called to the Foundation for Women and asked what to do. I know them because I have collaborating with them over 30 years. Christina, tell us what to do. I have a woman, she was scheduled for the abortion tomorrow morning. At 12 in the midnight, they introduce a new law. There is no possibility to make abortion in case of fetal impairments. What to do? Woman was in the lift and she was going down and up, crying. And they couldn't stop that. And so for the first time, I advised them, please phone and ask for the psychiatrist to this situation. Ask the psychiatrist. And if psychiatrists sign you the decision, you can do this abortion. And they did. Really, it was the first example. But, you know, we have a tragic phones during this night. Men, brothers, fathers, uncles, friends called us what to do right now. Could you help me? My daughter will give birth, in 3 months. I'm afraid just to send her to the hospital. Which hospital is friendly for her? In which hospital her health will be more important than fetus health? Because, this was really a tragic situation, and women living in small towns and villages, they didn't decide to travel abroad, even if we had this possibility, because it's expensive. They never traveled by plane. They never were abroad. They don't speak any foreign language. So we arranged them the help within the Polish health system, even if it was, a thin line for both gynecologists and us as well. But step by step, mental health was included into the reason for legal abortion.
I think in the US, particularly in a state like Indiana, we don't have referendums. We'll never be able to change our legislature, very unlikely to have a democratic political system at all. So really for us, the only option is a national abortion protection. And I think certainly my first choice would be no law. My second choice would be national protection for abortion. The problem is what that will look like, what restrictions. Again, as I said, once a law is introduced, there's some type of a compromise always that will happen. Will there be restrictions on gestational duration at which you can obtain an abortion? What restrictions will be included in that law, I think is yet to be seen. But I appreciate your points about resistance, which is I missed in ours, which is really getting people abortions, funding them, providing them, getting them across state lines, getting them everything that they need. The difficult thing that we're seeing now is all of the huge influx of funding that came after Dobbs is gone. Where now we have no funding for patients. We have lots of patients who are unable to access abortion in other states because they don't have funding anymore.
I think, if I may, I just want to underscore 2 of those points. One is, I think people who live here are aware we have absorbed many, many, many patients from our surrounding states. And so our clinicians are working overtime to take care of the patients Caitlin can't. And that funding has diminished. I mean, there's some, but it has diminished that is paid for people to travel. So those numbers won't stay up, right, as people can't get out. So you can have a right to travel that is a theoretical right if you can't pay for the bus ticket. The point about a national law, whether it is the kind of law, so the idea that the federal protections being a floor, not a ceiling, where it's the kind of law that provides a minimum standard of care, and so Illinois can provide more, or if it's the kind of law that attempts to be controlling on this issue will be an interesting conversation going forward, short of a constitutional amendment in the United States. Okay, great. Next question. I saw a hand here next, and I saw a hand here in the back. We'll move our way to the back as well, and the other side.
Good morning. My name is Alex. If we're continuing geographical connection, I'm from Indiana, so I thought that was pretty cool.
Me too.
So you've said a lot about the coalition that you're building to expand abortion access, and I was curious then to know how you characterize the side that you're fighting. So there's a lot of talk about family values, about morality, especially within the church, but it seems that when you're talking about a healthy family, or this has been known for decades, that the family that actually is most healthy, most joyful, that contributes the most to society is one where all the children are wanted, where the parents are able to take care of them in a stable situation. And so I wonder, in countering that hypocrisy, how do you accurately characterize the people that you're fighting against?
Say that last sentence again, Alex. I didn't catch. How do you accurately characterize?
The people that you're fighting against and their values that they are attempting to espouse when they're fighting against. Yeah.
I mean,
Sure. I mean, I would just say I can't remember which of my colleagues said it. Perhaps Christina, when we were at dinner last night, was saying we don't refer to them as the pro-life movement within her context because that's not what they're seen as. And I think that's a really valid and really important point. I think I generally try not to characterize the opposition as anything, frankly. I mean, I think it's important for us to recognize that, yes, there are a lot of groups that are very active and are really driving the charge towards restricting and undermining abortion access and the legality of abortion. But particularly in the US context, what I think is really important to remember is that it's actually the government that we need to hold to account. That at the end of the day, even though these groups and these actors are wielding enormous power and are able to enact, are able to get these types of laws and policies enacted, it's actually our elected officials who are the ones enacting them, and that they need to be the ones who are held to account for the impact that these laws have on individuals.
if I may, I'll say I characterize them as neighbors. Because I refuse to participate in the polarization. They're neighbors who maybe see the world differently than I do. I also think about honest abolitionists, people who have genuinely believe that an embryo or fetus has a high moral status, maybe higher than or equal to you and me. And then those who use abortion as a proxy for misogyny or political power or some other sort of thing. And I'm very interested in engaging honest abolitionists as neighbors and figuring out how we can coexist when other people's choices feel very distressing to them, and I understand that, but also that's called living in a pluralistic society, and not engaging in fake conversations with people who really are just using this as a political football or have other gender missions. So, but I do think as an ethicist, my work is about making a values case in favor of abortion access, because I do think underlying what you're saying is the idea that we talk about rights and those who oppose abortion access talk about values. And I think that's a mismatch that hasn't always served us, because there's so many values behind the desire for those rights, and their values arguments leads to the diminishment of rights. So those are rights arguments too, right? Fetal rights. So there's a way in which we need to increase the nuance and complexity of all that, and also then shift it to the dinner table rather than the political podium.
Yeah, still it's a very difficult discussion on the values and human rights. I just tell you the example from Poland. During the collection of signature under civic draft law on liberalization abortion in Poland a couple of years ago, we were visited by many elderly women. They were Catholics, because they explained us, and there was a long conversation before the signing the draft law, and they said me, you know, I will sign this draft law even if I'm practicing regularly Catholic, because I don't want to decide about somebody else's life and health. I don't know what is the problem of this woman, why she took the decision to end this pregnancy. I don't know. And I don't want to be guilty for her life and to, to decide. That's why I will sign this draft law. So it depends on people, religion, everything. But if you are enough open person and you don't neglect the others' decisions, I think that it's against the unmoral. It's moral just to secure and to believe that the only person who can take a decision in this difficult issue, maybe for her also, is a woman. No others.
I think from the medical perspective, I usually characterize them as non-evidence-based, right? So if we look at, what does the science say, what does the evidence show about abortion, all of it shows that abortion is necessary, it's medically safe, and in many situations, it's, much, much, much safer than continuing a pregnancy. And so if our goal is the same, which is to have healthy people, healthy families, prevent maternal mortality, then abortion must be unrestricted. And there's no real other argument around it. The challenge is when that's not their argument, when that's not their goal.
I'd like to turn to this side of the room and we'll move our way back. Uh-huh. Sorry.
Thank you. My name is Maureen. I want to thank each of you for the courage you have, because it's rough to do the work you do, because I know you must be up against a lot of heat many times. I am an obstetrician, gynecologist. I relate to so much of what you said. I am now presently retired a year and a half ago. Thank you. But I know, I think deeply about every single comment, and I think that storytelling, even among medical people, is where maybe we'll start to make some change. I'm glad to hear that there are more advocates, because it has astounded me really how ignorant I guess people are, and it doesn't help when I hear crazy stuff out there and during this election about stuff like, doing abortions after birth and all that kind of stuff. But still, there's a lot of misunderstanding, and maybe by bringing when we divided elective, totally healthy female abortions away from hospitalized or healthy, people with illnesses, when we separated that among medical people, that really caused a big problem. But even medical people don't speak about it always so clearly. And I'm familiar with, well, one thing, I think about what Ireland did. I heard at another conference one time, and partly being of Irish descent, I was amazed that they legalized abortion. I was amazed. And my impression from this conference was that this other conference, that they said they did it by going door to door, knocking on doors and very patiently listening to people's stories. And I thought, wow, that is really cool. It's amazing how powerful that is. And I think even now, I know there's discussion and whatnot, but I think people get it all very mixed up and just don't understand how much we, in OB-GYN, for example, you don't think in terms of what is maternal morbidity, mortality, illness, rape, incest. It means nothing. It means all this. I used to kid around, by the time you legally prove rape in this country, the kid is in kindergarten. It doesn't even mean anything to us. So then you just add to the problem by, making it look like there's all these distinctions or special lines. I did want to ask, what effect do you think, what is the quickest way to perhaps do a national, approval of reproductive rights? Would it be, for example, the ERA, which my understanding is all ratified, just not certified? It's just sitting there, ready to go. Would that immediately help quickly legalize and put to rest a lot of this suffering?
I don't think so. And the reason is, without completely con law dorking out, right? Like the idea of like, if you, we already have an equal protection clause and the ERA would bolster that, but it doesn't include the language of abortion. And so if you say, well, that men and women aren't similarly situated in this situation because women become pregnant and men don't, there's many arguments that a court composed as the current court is could distinguish abortion, I think, even with an ERA. And I think that goes to who are the people interpreting the laws. So unless you have, in my mind, in this particular political moment, a phenomenally clear, as in, I believe, France, the language of abortion protection in the US Constitution, which would be a different amendment ratifying process. I don't think, I would love to have an ERA. I'm all for it. And use what you can. And we'll hear stories from Kenya this afternoon about getting the word health and then using the World Health Organization. I'd take it and I'd argue it, but I don't think it's any kind of slam dunk, is my estimation. Okay, do you feel otherwise?
No, there is no fast avenue to national abortion legislation in this country. I mean, there's like our federal legislature literally can't do anything, let alone pass something as controversial as abortion rights legislation.
They can keep the lights on.
Yeah, exactly.
Next question. Yes, in the purple? Yeah. That microphone's right behind you. There you go.
I'm a returned Peace Corps volunteer, and I served in Malawi. This is really neither here nor there, but I just couldn't imagine when I served 30 years ago that anybody would want an abortion, because infant mortality was really very high, and it still is. But being in the United States, I'm just baffled that we allowed the media, first of all, to characterize us as either pro-life or pro-choice, and we let them get away with it. And I'm not anti-life. And the people who say that they're pro-life, they're really anti-choice. But more than that, there's two arguments that I never hear. The right to privacy should be fundamental, and clearly the Supreme Court that we have now, they're not legal scholars, but we're dealing with now a question of philosophy, when life begins. And we have a bunch of basically men or religious people who are not scholars telling us it begins at conception, where in my religion, the religion I was brought up in, that you're not alive until you take your first breath. And in some religions, like the Sikh religion and Buddhism, it's not addressed at all. It's just basically your relationship with God or morals or your community or whatever. And I don't know that we can get around it unless we ask them who say that they are so sure that life begins at conception, how you know this. And that's basically the argument they're using, is that because of Christian scripture, that's what our law is based on, even though we're not supposed to be respecting religion in this country. And we've even made our foreign policy on that, Helms and Hyde. I mean, we're just not making the argument. And as you said, it's going to take going door to door, having this discussion, because all these philosophical people are saying that they're right. They're not adopting children. They're not passing legislation that helps families, and we're letting them get away with it.
Anyone want to respond?
I think maybe just to respond to that, I think it's important actually to reflect on how other courts have grappled with this issue. So the American Convention on Human Rights actually explicitly recognizes life from conception, but the Inter-American Court has actually explicitly said that they are not going to define when life begins, because that's not a question for courts to define. That the idea, just like you're saying, of when life begins is not simply a legal question, it is an ethical, it's a spiritual, it's a moral question that to each individual means something different, and that a court is not actually in the right place to make that decision about. Just to add in that same sense, though, the Inter-American Court was forced to grapple with the idea of when do the legal protections sort of bestow themselves, because there is this explicit language in the American Convention. But the court actually fell on the side of that even if there are protections for life prior to birth, those protections must be gradual, they must be incremental, and they must also recognize the full spectrum of human rights that the person carrying that developing life has. And so I do think it's important just to contextualize this idea that I agree, the idea of what life is not simply a legal question, it brings in a lot of other dimensions, and that courts have actually intentionally chosen not to resolve that issue and to recognize that they are not always the answer to every question.
And that's literally a paragraph from the Roe decision of that when philosophers and theologians and others can't agree, doctors can't agree, the court is in no position to take a stance on, quote, when life begins. We get it biologically, but what we mean is what I call capital L life, life that has moral status, that requires protection by the government, right, against others who would harm it. So we went down that road, we had a ruling, and then it was undone. It's interesting to me on a state by state level how those arguments are then playing out. And there are, of course, from the Jewish faith and others, freedom of religion claims going on in a couple states to try to tackle that from the angle you suggest. That if this is going to be a religious argument, then that can't be codified into law. And that's a complex argument as well. Other comments and questions? Yes, in the way back there with the there you go. Thanks.
Good morning. My name is Natalie Moore, and I'm a journalist and a faculty member at the Medill School of Journalism. I just wanted to offer a point of clarification about pro-choice and pro-life. The standard in newsrooms is not to use that anymore. I see one of my colleagues here. If groups self-identify that way and it's in their name, we use it. But we have really moved away from that and say for abortion rights or against abortion rights and try not to use the language of activists or advocate groups to weaponize for the public. So just wanted to offer that.
Appreciate it. And then right behind you.
Hi, I'm a political scientist and a public policy scholar. My question is around funding and around political advocacy, because these are things that you've both touched on. My research looks at, I've done research globally on the global gag rule and abortion and how that has impacted people. I've also done a lot of work in Kenya. I'm looking forward to the presentation this afternoon because my field work has looked at how NGOs in Kenya responded to the COVID pandemic and the uptake in abortion access that was needed and with the decrease in funding from the US and how that impacted them. But I currently have some work in the US partnering with abortion providers where they are encouraging their patients to vote. And I didn't know if this, I'm a political scientist coming this from a very political sciencey angle, but I'm curious from a legal perspective or an OBGYN perspective, what you think, people from other disciplines can do to help advance the agenda with regards to, funding advocacy for physicians and things like that. Thank you.
Yeah, absolutely. So the Vote ER campaign is probably the most kind of widely known in terms of trying to advocate for physicians to advocate for patients to sign up to vote. There's good evidence that voter suppression decreases equity to healthcare as well. And so anything that we can do to improve that. I don't have I instinctively went to grab my badge and turn it over for my Vote ER QR code to vote in Indiana. So yes, we are certainly promoting that campaign. And I think, I think it depends on what you're looking for. I mean, certainly understanding that funding has decreased significantly and the absolute human impacts. I appreciated the candidate Harris's comment recently and kind of walking people through, can you imagine getting in a TSA line in order to go to get your abortion, what that actually feels like and back that up several steps to the scraping together, literally taking food out of your children's mouths to be able to go and access an abortion, what the lack of access to those funds physically means for a human being in your community, I think anything that we can do to get that story out is important. And so, when you're looking at whether that's evidence that we can bring, papers, manuscripts to our elected officials to say, this is what this means, the increase in maternal mortality, the increase in infant mortality, the increase in foster care, the huge increases in number of children needing foster care and what that means for our communities. Any evidence that you can provide in your field is incredibly important, both for the lay people as well as for the policymakers.
And to tie that to the ERA comment, in Illinois, of course, we do have Medicaid coverage for abortion, and part of the way we won that argument in our legislature was a gender equality argument. That do you see our state Medicaid program covers all the common medical procedures for men and not this procedure that 25% or more of women will need. That's just gender discrimination. And from the medical ethics perspective, it's a form of economic coercion that we will cover childbearing and we will cover contraception, but we won't cover abortion. And the number of counselors have told me that people in prenatal care are saying, I don't want to have this baby, but I don't have $500 to not have this baby. But this is paid for in terms of your comment about what a way to start your life, right? So those are also values arguments around the funding piece. I think that we're probably close to out of time. Yeah. Yeah, there's one more question at the back, yeah, and then we'll pick right back up again. We'll have a break for 15 minutes after the question and responses, and then we'll pick back up again to talk about expansions of access of abortion care.
Again, on the issue of affordability, it dawns on me that I don't work in this field directly, so I don't know how it is, but I am assuming that the clinics that provide abortion care require the payment up front, because you always hear of women having to save the money. It would seem to me like if they could put the people on a payment plan so that they only have to afford the bus ticket up front and can pay $10 a week for the rest of their lives, for the remainder, that might enable people to travel, to continue traveling without needing more donations. Or also a microloan program like they have in many countries for women to start their own business. Again, that money, those funds would be repaid, so it wouldn't just rely on a continual stream of donations. But if you could have a revolving fund where women could take out a $1,000 loan, $500 loan, and then have the procedure and repay it later. Any of those ideas ever considered?
Just to say, so it depends on kind of where that abortion access. So for example, in a hospital-based system like I practice in Indiana, because we're only allowed to provide abortion in the hospital, we do have that option through our hospital fund for payment plans. So it kind of depends where that's being happening. I think the challenge, of course, that clinics are really operating on razor-thin margins. Most of them are losing money realistically. And so being able to keep their doors open on, for some type of a payment plan that will realistically never happen given the medical debt that is present in this country is just not feasible, unfortunately.
I think a lot of people think about abortion care coming from Planned Parenthood, but actually a large, I don't know, I want to say it's a majority, but a large amount of abortion care comes from private clinics. And so thinking about those individual clinicians, which as Dr. DeMaron said, are often, if they are making a profit, it is very small. They're often also seeking grants to subsidize the cost of care. There's sort of all these other avenues. So then the idea of taking on becoming sort of a loan broker of sorts, it's just a lot to ask from abortion providers, right?
Thank you. Well, I want to thank all three of our panelists for their expertise and their long-standing work and all the work that there is to come. And we'll be back in 15 minutes after our break for our second panel. Thank you.
And as before, I'm just going to introduce the chair of the panel, our colleague Sarah Rodriguez, who will go ahead and introduce the rest of the panelists. Just again, thank you to our first group of panelists for a fantastic discussion. I'm really looking forward to this one as well. Sarah Rodriguez is a professor in the Global Health Studies program here in Evanston, as well as a lecturer in medical education at the Feinberg School of Medicine. She's a historian who focuses on reproductive health and the history of clinical research ethics. Her most recent book is about an Ohio OBGYN who thought that he could, with a little surgery, enhance the sexual responses of the new mother. It's entitled The Love Surgeon, a story of trust, harm, and the limits of medical regulation.
Thank you all for staying or coming if you've just joined us. And if you have just joined us, we're going to follow the same format as we did this morning, which is I'm going to briefly introduce the three panelists up here. Then they're going to speak for 10 minutes each. And then I'm going to ask a couple of questions. Then I'm going to ask you all to participate with some questions as well. So we'll start with my colleague on the right here. And Camilla Fitzsimmons is an associate professor of adult and community education at Maynooth University in Ireland, and author of Repealed, Ireland's Unfinished Fight for Reproductive Rights. Next to her is Catalina Martinez. She's vice president of the Latin American and the Caribbean unit of the Center for Reproductive Rights. And then finally, our last panelist is Evelyn Opondo, director of the International Center for Research on Women's Africa Offices. So we'll start then, if you're okay, we'll go in order. And again, each will speak for about 10 minutes, and then I'm going to ask some questions, and then I'll open it up for you all to participate with questions too.
Great. Can you guys hear me? Yeah. Hi, so my name is Camilla. The big challenge for me here is going to be the 10 minutes piece. So Sarah, give me a nudge if I lose the run of myself. Yeah, my name is Camilla Fitzsimmons. I'm from Ireland. Just to give people a little bit of context, so Ireland is a small island off the west coast of Europe. Not everybody knows about Ireland. It's important. There's about 7 million people live in Ireland at the moment. Until 1922, Ireland was a colony of the British Empire. To this day, 6 counties of Northern Ireland remain part of the British Empire. So that's the kind of historical context, I guess, for Ireland. The reason I'm sitting here is that in 1983, and against the tide of what was happening across Europe at the time, Ireland introduced a constitutional ban on abortion, which lasted for 35 years. So it went into the Constitution when I was 13, came out of the Constitution when I was 49. So for the whole of my reproductive life, whatever expression you want to use, this ban on abortion was in place, which really had much wider ramifications, as often happens. It really kind of impacted the status of women much more broadly in Ireland. I'm just going to make 3 quick points, if that's okay, and I'm happy to come back on any of them later on. I want to talk a little bit about the context when the ban went in. I want to talk about the campaign that resulted in its eventual removal, and I want to talk about Ireland today and why it is an unfinished fight. So 1983 was a time when Ireland was really a theocracy. And, you know, sometimes I hear people talk about parts of the United States, and it really reminds me of my own childhood. If something was morally wrong, there tended to be a law about it, be that contraception, be that divorce, be that abortion. So it was really no place for women in the 1980s. My own mother had 10 pregnancies, 9 children. When the abortion ban was introduced, it was solely within a moral context. I would have been given a little anti-abortion pin that I would have been given in school, would have worn very proudly, never would have made the connection between that and my mother's life. And I guess when the ban went in, it was a small group of ultra-religious, mostly men, who got the ear of politicians, took a feminist movement, which was quite active at the time, by surprise, and got this ban in, which was a devastating defeat for feminism in Ireland at the time. And part of the reason, I think most historians would agree, is that the feminist movement at the time was split, it was kind of divided. We weren't clear on our own language, partly because we just weren't used to speaking about abortion. It just wasn't something that was ever talked about. So from the moment the ban went in, the campaign to have it removed began. When I was in my 20s, this is pre-internet, you have to remember, what I remember of the campaign was if you went into the city centre, people would be shouting out phone numbers, which were helplines for women, or handing out pieces of paper, which had the helpline on. And there was several kind of attempts by the government, really, I mean, mostly instigated by anti-abortionists to stop those kind of actions. So there were injunctions put out against healthcare providers who were simply giving information, obviously, at that stage. But this 35-year campaign continued. It ebbed and flowed, but it was always there. Sometimes it was a handful of people, sometimes it was tens of thousands of people, depending on what was happening. What really brought the tens and thousands of people involved were when particular cases broke through the news. So people may have heard of the X case in 1992, where a 13-year-old girl was refused the right to travel to the UK. She had been raped, and she had to go to the Supreme Court to eventually be allowed travel, and that resulted in the first change in law. The death of Savita Halappanavar in 2012 was another key moment when that kind of small group of activists really expanded big, and the whole country got involved. But my scholarship is about social movements and feminist movements, and I would certainly argue that if those small people hadn't been there the whole time, it probably would not have happened. So people were talking about knocking on doors earlier. Huge part of the campaign in the last year was knocking on doors. But there was that dedicated core of feminists that kept things going. And just to say that throughout the campaign, the Irish government, at every stage and at every possibility, opposed, fought to retain the ban in the European Courts of Human Rights, to the UN Commission on Human Rights, within our own courts, within Parliament. All of the time, they never, ever, ever conceded in any way, until they eventually had no choice but to give in to the absolute crescendo of tens of thousands of people marching, of journalists writing, of artists, of many, many different kind of pathways towards wanting to get this constitutional ban out. So eventually the government called a referendum, and it was an overwhelming victory for the repeal side. Just the third piece, and I'm okay for time. Oh, good, I'm okay for time. I can slow down a little bit, that's okay. I mean, just maybe to linger on some of those stories, because I know stories was mentioned earlier as to what got the general public kind of galvanised. Really, really terrible things happening in Ireland. So just two cases to bring to light. I mentioned Miss X, and this was what happened in Ireland. People were given these alphabet acronyms, so sometimes we talk about the alphabet soup of cases in Ireland. There was a woman who was called Miss P, who was in a terrible accident whilst she was pregnant. She was pronounced brain dead. She was on a ventilator, and her family were refused the right to switch off the life support because there was a fetal heart rate. This was just devastating for the family. So they had to go to the highest court in the land in Ireland to have that overturned and eventually have the right for this woman to die with some dignity. A second case, a young woman called Miss Y, who was a victim of rape, who had came to Ireland seeking asylum, and there was a risk to her own life because she was suicidal. And at that time, we had this really bad law that had come in. So there were a couple of times when legislation was introduced based on on these previous cases. But she was refused the right to an abortion. To get that right, you had to face kind of 5 doctors, minimum of 5 doctors, and make your case. This is a young asylum seeker coming to Ireland, and she was refused the right, and she was force-fed and then forcibly had a cesarean section done on her against her will. So this is the level of what happens when abortion bans are in place, and these are only the cases that we hear about. So in 2018, then anyway, we had this referendum. There was about 20,000 people knocking on doors the length and breadth of Ireland, including myself, my 17-year-old daughter, all of my neighbours. It was really a good time. But since then, things have not been good. First of all, the law that was introduced in Ireland is one of the most conservative laws in Europe. Up to 12 weeks, it's a great law. You can have abortion on demand through a GP. There is a very patronising 3-day pause period, which I think a lot of countries have. But other than that, it's okay apart from a conscientious objection clause. after 12 weeks, it's practically impossible to have an abortion in Ireland, and we still have people travelling. We reckon about 7 people a week now travel overseas. It used to be about 15 people a day before the ban was repealed. But the law is only one of the problems we have in Ireland. We also have a significant problem with services. We only have about 15% of GPs, general practitioners, community doctors, that have signed up to offer abortion care. And we also have 19 maternity hospitals in Ireland, and just 11 are providing abortion care. And the government in Ireland has done nothing about this. They do nothing to improve the law. They do nothing to force doctors and hospitals to provide care when it's needed. And we also have this increase in rogue clinics, is what we call them, these kind of fake clinics who bring people in and then lie about their gestational dates and really kind of fool people by false advertising that says they're going to offer care. So, I mean, the fight continues in Ireland. Things are definitely much better than they were, but I think changes in the United States as well has sort of the impact that has had on Irish politicians is it's made them less reluctant to make the sort of changes. They haven't gone the path that France went, for example. They've gone the opposite path, and they're kind of, oh, maybe we need to rethink this, is kind of the attitude in some political circles. And we have one political party in particular who are solely running on an anti-abortion ticket, and they are small, but they are present, and they have a couple of people in Parliament in Ireland. So I think that's all I'll say for the moment. So a really good news story, but also, not as good as sometimes people think it is because of all the ways that abortion activists are shut down as much as they can. Thank you.
So hello everyone, I am Catalina Martinez, I am from Colombia, and I was invited to talk about global expansion in my region. And with your the last part of your intervention, I want also to start saying that even if I am gonna focus my intervention in expansion, we need to be very clear that this fight and this work is a balance between expansion and restriction, between progression and regression. Like, that is the history of the work that we do. But the reality is that in the last 5 years in Latin America, we have had very important victories regarding abortion rights. In 2020, Argentina liberalized abortion up to 14 weeks of pregnancy. And this was the result of like a massive mobilization from social movements and civil society, and also the result of a government that was supporting that mobilization and that presented the bill before the Congress. Then in 2021, in Mexico, the Supreme Court released a very important decision where the court recognized the right to decide, and it protected the abortion under the right to decide. And this is very important because, as the United States, Mexico is a federal state. So the Supreme Court deciding this in Mexico was very important because it brings this constitutional protection for the whole country in 2021. And after then, the different states have been adopting, have been liberalizing abortion like in a progressive way. And then in 2022, Colombia, the Constitutional Court in Colombia adopted this very important decision that decriminalized and liberalized abortion up to 24 weeks of pregnancy, which means that today Colombia has abortion under request and has one of the most protective framework regarding abortion worldwide. And a lot of people have asked me how Latin America have done this, being one of the regions with a lot of restrictions, legally, socially, culturally, regarding reproductive rights. And I maybe would like, because I am in a university, start with a story. When we were litigating the case in Colombia, before the decision of the court, we had in the country 3 grounds to access abortion: when the life and health of women were in danger, when the pregnancy was the result of a rape, and when the fetus has a fatal fetal malformation. Those were the grounds accepted in the country. And the implementation of those grounds was very difficult for many reasons, but I will tell you one that I think is the most important one, and is that when you have a model of grounds, you are letting the decision to a third person. It's not the woman who is deciding about her health, her body, her life, but it's a third person who is deciding if this person has a risk of life, or if this person really was a victim of rape, no? Like, and when a third person is intervening in this decision that is so personal, it is like the formula for not succeed, because you are subjected to the subjectivity of the third person. So in our litigation, we wanted to fully eliminate the crime of abortion from the penal code. We were saying to the court, you need to declare unconstitutional this crime, because abortion is a health service and it needs to be regulated under health provisions only and not in the penal code. And at the end, the court decided to decriminalize in a very, I think, broad a period of time, 24 weeks, and liberalize under request abortion services for this period. And when we won the decision, I remember that we were in front of the court, and I can swear you that the center of Bogota, the capital of Colombia, was shut down, because the people that were in the streets was massive. Like, it was impressive. And after 2 weeks of the win, I received a letter from a professor of a university, very well-known university in Colombia, that told me that the day the decision was being made, she was in the classroom with her students, and she saw her students that were like very excited, that couldn't concentrate. The students began like leaving the room, and she was like, what is happening? No? Like 2 days after, they came to the classroom, and all of them were wearing the green bandana that is the symbol of the abortion fight in Latin America. It's a green pañuelo that we wear in the wrist, and they were wearing the green bandana, and they were talking in the classroom about this. So I received that letter, and she was saying to me that she was very happy because the day a historical decision was being made in the country, her students preferred to leave the classroom to be in the streets waiting for the decision, no, than attending the class. And that day, I realized something that for me was very important, and is that we managed to get out of the courts what was happening at the court, no? We managed society to be aware of why this was important, why this was a matter that all of us need to care about. And with that, and because a matter of time, I have like 4 thoughts that I want to leave that I think has been important for us in Latin America and in our context to give these fights. The first one is like really like to think about what is the venue that we need to use to change the law. And even if it is the law that we need to change, no? It is the law that we need to change, it is a public policy, it is a protocol, like really to be clear on what is the thing that, the legal framework that we need to change so that we can put together a strategy. And then the venue, it is the Congress. In Argentina, it was the Congress because they had the majority. But the reality is that in the majority of our countries in Latin America, it is the court who has been very important to succeed in the change of our rights, or in the recognition of our rights. And I think that this is very different from the US because our constitutions have incorporated human rights framework as part of the constitution. We have recognized international law as part of our constitutions. So for us, like going through the constitutional way has been very important to succeed. The second one is that even if the law changes, that doesn't mean that we are going to have a good implementation. And that is when I realized that, or we realized that the law is not enough. Law is not enough. Like, we really need to be able to do a social decriminalization of abortion. That is how we have called it in Latin America. And the social decriminalization of abortion means that you need to put this in the public conversation. Like, this needs to be a democratic discussion. People need to understand why this is a matter of right. People need to go to streets when this decision is being made, because it is important for their rights and their stand in a society. And I think that what the green wave, the Marea Verde in Latin America, has been done is exactly that. And I can tell you that when we were litigating the case in Colombia, we were part of this huge movement called Causa Justa, and Causa Justa was everywhere during the 2 years of litigation, like in the press, in social media, in the streets, in the field, working with communities. Like, really, like, we were talking about this with the whole country, which was very important. And from those 2 years, I remember that the news at the end, like when the decision came from the court, were very good news, no? Like the coverage from press was a coverage that we never saw in the country, like more freedom for women, equality has won in the country. And we're like, oh my God, like, journalists are talking about like that about our rights in Colombia. It was something like really huge. Finally, it was also a collective work. Like, we really joined a cause. We let go our logos of our organizations, it wasn't one person, it wasn't one organization, it was a group of organizations. We mobilized together under one name that was Causa Justa, and Causa Justa was the Center for Reproductive Rights, was Women's Link, was La Mesa por la Vida, was everything was under that. It was a joint cause. Also, we brought non-traditional allies to the fight, which means that we made a list of 200 opinion leaders of the country, 200 opinion leaders of the country that have never talked about abortion, but that had a lot of liberal thoughts about democracy. And we talked with them, like, this is our fight, this is important, we need you to join our cause. And at the end, these 200 persons did it. And they were like writing about this, putting this in their social media, talking about this in Congress, talking about this in their political agendas, not depending on what was the field of this opinion leader. And that was very important for us, because then the bubble was so big, no? Like, a lot of audiences came to our discussion. And finally, solidarity. I think that this is something that we cannot do alone from the repro movement. We need to work in an intersectionality way with other movements, social movements, because at the end, the division between our movements only serve to the system that we want to change. So having that in mind, like, to be able to work together is very important, because at the end, our fight is not only a fight only for abortion, it's a fight for human rights, it's a fight for democracy. So yeah, that's it for me. Thank you.
Thank you. I was asked to speak about the status of access to abortion in Kenya. I want to start by saying that the status of abortion in Kenya is like fetching water in a leaking bucket. There is so much focus on post-abortion care as opposed to the prevention of abortion care. And by the time the government or the system comes into place, a lot of women are on their way to their deaths or are actually going to be living with lifelong disabilities. To give a little context about the magnitude of the problem in Kenya, in 2022, we had about 21,500 reported cases of sexual gender-based violence, and those are only the reported ones. And out of those cases, 36% were adolescents between the age of 10 and 17 years. Now, 60% of cases of sexual assault were reported after 72 hours. That means that those cases, they were not able to get the emergency, the post-rape care. That means that a lot of them were not able to prevent sexually transmitted infections, and a lot of them ended in unintended pregnancies, and therefore got into the pathway of post-abortion care. Now we have about 17% of cases of post-abortion care being of children, of minors between the ages of 10 and 19 years of age. And then the last statistic I will give is that we have 7 women dying from abortion every single day. And that's an even outdated statistic because the government is not collecting those statistics. I want to share with you a very tragic case that we litigated and that illustrates the problem, the reality of abortion, unsafe abortion particularly in Kenya. Now, JMM, the girl that we represented, was a 14-year-old girl living in rural Kenya from a very poor family. Her mother was the only parent that they had in the house. She was illiterate, she was unemployed, lived on less than $1 a day, and JMM was the 5th and last born of the children that she had, all of them unemployed. Now, JMM knew that for her to get out of poverty, she needed to invest her time on education. And so she walked 30 minutes to school every morning and walked back 30 minutes back home in the evening. But you see, a lot of girls are sexually assaulted on their way to school every day. And on one fateful day in 2014, when JMM was only 14 years old, she was raped on her way to school, and she became pregnant. Now, had she had access to comprehensive sexuality education, she would have known that she needed to access, she could have accessed post-rape care. But no, comprehensive sexuality education is not taught in our schools. Now, if her community did not stigmatize teenage pregnancy that much, she would have walked into a facility. If those facilities did not stigmatize abortion so much, she would have sought help when she learned that she was pregnant. Instead, she reached out to a friend of ours who was also a teenager, who advised her and, in fact, accompanied her to some, I would say, quack who was practicing abortion in the vicinity where they believed. Unfortunately, everybody knew about it, but the government did not do anything, and so many girls were losing their life to that. So a few hours after that, JMM was bleeding profusely and in serious pain. She was rushed to a dispensary that was 3 kilometers away from her to be assisted. In that facility, she stayed there for a number of hours. She was not assisted. They could not stop the bleeding because that particular facility did not have any qualified medical personnel to attend to her. Neither did they have any appropriate equipment for post-abortion care. She was then rushed to another higher level, like a state, in this case, a state hospital, which was about 16 kilometers away. In that facility, she stayed there for 3 days. They managed to arrest her bleeding, but at that time, her kidneys were already failing. And in that particular facility, she was told that that facility did not have a dialysis machine, and therefore she was transferred to another facility about 50 kilometers away. And unfortunately, when she was going to that facility, she could not, they could not afford an ambulance. So the mother sold her only cow to get her a taxi, but the taxi did not have the appropriate equipment for that long journey. And by the time she reached there, she was in critical condition, and she was put in ICU for 7 days. After the 7 days, they actually stopped the bleeding. But then she was told that in spite of having been transferred there for dialysis, that facility, in fact, did not have a dialysis machine. She was then transferred another 232 kilometers to the biggest referral hospital in Nairobi. And in that facility, that is the place where she finally received good care. Unfortunately, there were so many delays along the way. By the time she reached there, she had, she was informed that she had already developed chronic kidney disease, and she would have to live on dialysis for the rest of her life. And then, unfortunately, after she was discharged, she could not pay. And in Kenya, if you cannot pay your healthcare services, your bill, you are detained. And so she was detained for another 1 month in that facility before the social workers then processed her and she was out. When they came to us, all she wanted was to go back to school, which we took her back. She wanted dialysis to be supported with the dialysis, which we also did. And then we filed a case against the government for the violations that JMM suffered. And I remember vividly on the last day in court, when we had her mother as our last witness, and she was so pensive, she was helpless, she was not her usual self, because she had come to the court knowing that JMM was on her deathbed because her condition has seriously deteriorated. And in that particular moment, it was very clear to the court, the cost of unsafe abortion is not just on the person who has had an abortion, it's on the family as a whole, whether it's economic cost, the social cost, the emotional cost, all of that. Unfortunately, JMM passed away soon thereafter. And in 2019, we had a groundbreaking court decision that really found that there had been several violations on JMM. Now, our problems are not just at the domestic level. A lot of the challenges that we experience are also because of state and non-state actors in other countries. The US is a particular perpetrator of the violations on abortion that we experience. I mean, even if you look at the evangelicals that are exporting their extremist agenda and rallying people and hugely funding anti-abortion, anti-SRHR, anti-LGBTQ movement in Kenya, but also the US state as a government through the global gag rule, the Helms Amendment. I would say, to give a quick example, in 2010, we passed a constitution that allows for abortion in case of danger to the life or health of the woman. In 2012, our Ministry of Health developed standards and guidelines for providers to give them, guide them in provision of abortion services. In 2013, a year after that, the Ministry of Health had invited stakeholders to a meeting on maternal health. And then the USAID in Kenya learned about this meeting and reached out to their grantees and asked their grantees not to attend that meeting for fear that the meeting would take a reproductive rights angle and that US government funds could not be used to promote certain reproductive health services. And you may ask, why did the government listen to them? Because a day after the standards and guidelines were withdrawn, the government listened to them because the US aid is the biggest development partner of health in Kenya. And so we went to court and we challenged that. And in 2019, the court reinstated those guidelines and said that the withdrawal was in fact arbitrary. And now you may ask, why is the situation in Kenya important for you? Why should you care when you live in the US? I would argue that you need to care because the extremists that we are seeing in Kenya are the US evangelicals. I have personally been listed in a website that is a US website, a hate website called Project C, calling on people, to attack us because we support abortion, as well as those who support, LGBTQ issues. I will also argue that, the cases that you are seeing in the US, right after you have tested them there, and even while they're in court, the same tactics are imported to Kenya. We are having cases that are supported, by organizations that are here, that are seeking fetal personhood, that are seeking, enhanced regulatory licensing for medical providers. We are also seeing them asking for surgical theater for abortion facilities, all of the tactics that have already been used in in the US. Now, what must we do now? I will say that it's really important for us to continue to organize transnationally, and I really appreciate, the chance that we've had here to listen to each other. We must continue this. We are organizing at the national level, at the grassroots level. We are litigating. We are seeking changes, in policy that are progressive, and we are also calling on you to keep the fight here, because what happens here affects us a lot. Even the falling of Roe, our courts have taken judicial notice of that. In fact, Roe v. Wade was cited in one of our progressive court decisions just about 2 months before the fall of Roe. So everything that happens here is important for us. And that's why we come in as the International Center for International Center for Research on Women, where we generate evidence that identifies the contributions and challenges of women, and we use that evidence for program design and for policy advocacy. Thank you very much.
All right. The first panel, we heard a little bit about stories too, and the importance of stories. And each of you have shared at least one story about that have sort of sparked mobilization or sparked movement or united people, basis of lawsuits, et cetera. Can you sort of expand more on why you feel like stories are actually important when we think about reproductive health, particularly about abortion rights?
Like kick off? Yeah.
Yes.
Okay, I have mixed feelings about stories. I'll be honest with you. I think certainly it was a big part of the campaign that repeals the Eighth Amendment in Ireland. But a lot of people, it took a big toll on them. So stories can be really, really effective in winning sympathy for undecided voters. In Ireland, because it was a referendum, it was about voting one way or another. And can, even in this room, really bring home to people the dangers of abortion bans. But sometimes I do wonder about the toll on the people who tell the stories. So in Ireland in particular, many women came forward in the media, on television, radio, in the press. Some of them got extreme hatred. The journalist called Tara Flynn was one of the first people to tell her abortion story. She was particularly targeted because she chose not to have children and also disclosed that she had had an abortion. And really, really, the personal toll that she took was really significant. So sometimes I find myself saying, surely we know enough now to create composite stories that we can use, instead of asking people to continually have to talk about their own circumstances when they're telling us that this is re-traumatizing for people. And when we know that a big kind of aftermath of Ireland repealing the Eighth Amendment was significant burnout for people afterwards, which lasted for a couple of years and longer for some people. So mixed feelings about stories from me.
I feel the same. I totally agree with what you said. I think that stories, agreeing with that, I think that stories are important also because people can recognize themselves in the story. Like some people are afraid to talk, don't understand what is happening with them, are asking themselves if there is something wrong with them in wanting this or the other, no? Like, and I think that stories are important because you can see that other human beings are thinking or are doing or are suffering or are going through the same questions that you are. So I think that is the true value of stories. And also I think that stories make also societies understand why this is important and what are like the real cases behind one restriction, no? And to give you one example, in Colombia, when we were litigating the case on abortion, a lot of people were asking me like, but I don't understand, why do we want like to continue like expanding abortion if we already have these three grounds that are very broad, and also like the health is very well interpreted, no? Like health is physical health, mental health, social health, so everything can fit under health, no? So people were like, why do you want to continue expanding? And I was like, because, you know, like even in the model of exceptions, we continue to see people that are in those exceptions, in those grounds, and cannot access abortion. And at that moment, one campaign that was very present in the country was the Niñas No Madres campaign, Girls Not Mothers campaign, which was a campaign of stories of girls, today women, but at the moment of the facts, girls, that were victims of rape and couldn't access abortion services, even though because of the age of their pregnancy, they could access under the rape exception, the rape ground in Colombia. And hearing those stories and then complementing this with data, of course, at that moment, for example, in 2021, more than 4,000 girls under 14 years old gave birth in Colombia, existing the rape ground to accessing abortion, no? Like, so complementing the story with the data was very important for people in society to say, oh, this is happening? Like, really? Even with our legal framework? Yes. Even with our legal framework, this is happening. Because at the end, what is creating the stigma also is the crime. If you have something in the penal code that is a crime, people immediately say this is wrong. So that is why for us it's also important to get out of the penal code from our bodies. Like really, like the abortion needs to be regulated in the health system. Like the penal code doesn't have to be like any kind of regulator body. Yeah.
I would say that stories are very important, and groups that are opposed to abortion are effectively using storytelling because they are speaking to the heart in ways that I would say we have not done. And I think we have not done that primarily because of the stigma. And so people are not necessarily going to come out and say, I have had abortions, in our context at least. But you know, these people who are, the groups that are opposed to abortion will use misinformation and disinformation. And unless we come out and we say, you know, we share the story so that they don't just look like theoretical things, but the reality, because for example, they will say that women who have had abortions, you know, have this mental torture that they are going through, and that, you know, they will never conceive again. They tell all of these lies. And unless we can come out and say, you know what, I had an abortion, I have children, I never had a mental torture, you know, that's really important. But I want to also say that, you know, when we tell stories, we have tended to also just share the stories, perhaps the very challenging ones where, you know, someone has ended up dying or with lifelong disability, or some really bad ones. But there are those cases where a woman just wanted an abortion you know, and that should be okay, that you can just walk in. I just want an abortion because I want an abortion, and that should be fine. Maybe there's no other story, I wasn't raped or anything. But I also find that in our context, when we shared, for example, the story that I just shared, in quotes, the story of that lady, that was the tipping point. Even the judges who were completely opposed to abortion, that story moved them. And so at the end of the day, you really want to ask yourself, what is it that we are trying to achieve? We are trying to change perceptions. We are trying to have the judicial pronouncements that are progressive. We are trying to have, change of laws, and whatever it takes to get there, I think we should take that. Thank you.
So I've already said, and my introduction was I'm a historian, and I teach history of reproductive health. And when I teach about history of abortion, I bring up a couple of things. I'm just going to share a couple to lead into my next question. One is that this idea of when pregnancy starts and what counts as an abortion are not stagnant, right? This is not sort of a historical constant. This has changed over time about what counts as a pregnancy, what counts as an abortion is not sort of like it's always been X, right? And just as quickly, for a long time and in many still places, quickening was essentially when pregnancy started. And that's essentially your first trimester into pregnancy. Because miscarriage was so common, it wasn't sort of seen as a solid pregnancy until after quickening. Second, as I think sort of technological changes has also radically changed how we think about pregnancy. And when I talk about the introduction of the home pregnancy test in the 1970s, you can suddenly find out you're pregnant at 6 weeks, right? But that might not be a pregnancy that's going to go much further, right? It might be a chemical pregnancy, it might be ectopic pregnancy. There could be all reasons why it is actually not going to be a pregnancy. But at 6 weeks, suddenly you know you're pregnant. And that also has radically shifted how we think about when pregnancy starts. As opposed to, in 1970, it could be a late period, and that's why. So thinking about those two things. And finally, the thing that always blows my students away is right before Roe was decided, the Des Moines Register in Des Moines, Iowa, which in Iowa used to be purple, did a poll of people to ask about how they felt about how abortion should be legal or not. 60% of Republicans said it should be safe and legal, and 40% of Democrats did. And I always point this out to students to say, this is a conscious choice of a decision-making of language, of how things are framed and understood, right? So my question then leading up to this is, if you could, when you were working on sort of changing laws in your respective countries, was there a particular sort of frame change about abortion that you felt was particularly resonant? And then my second question is actually, if my mom would always be like, if I could wave a magic wand, this is what I would do. So if you could wave a magic wand, how would you want abortion to be understood and framed? Do you want to start again?
Yeah, I can start again. So I think the way abortion was framed in Ireland was really central to its history. If you go back to 1983, when the constitutional ban on abortion was inserted, as I said earlier, feminists were really taken off guard by that situation. So much so that all of the debate in 1983 was legalistic. The word abortion wasn't even used. It became an argument about what was called the substantive issue, was the language that was used across television, across radio. And really all of the discussion was in the moral realm and in the legal realm, at what time life begins. And obviously the Catholic Church was a huge influence in Ireland at the time that I didn't mention. And this was on foot of previous court hearings about contraception. So Ireland had already been through the courts about right to contraception, with many of the same arguments around, life, you're preventing a life, God's will, my father used to say it to my poor mother all the time, who had 10 children, it's God's decision how many children you have. This was the constant thing that we were told. And I think the fault of the movement in 1983 was to allow that legal discussion to dominate and not to talk about why people need abortions. That was never discussed. It was never talked about. Economic reasons being a principal part of many people's decisions, but all, people, like I said, imagine my mother with 10 children already, and all of the other reasons why people have abortions, not just because of a risk to health or life. And that really allowed the legal realm to exert huge power over abortion debates for many years, instead of just being very clear from the beginning. There's no, as has been said many times already today, this just shouldn't be in the law books at all. This is, should be like having your tonsils out. There's guidelines that doctors and maternity hospitals have to go by. So sometimes people say, oh, we need to have some law because we need to protect people from unscrupulous practitioners. And I always say we do have those laws already. We have all of those guidelines in place around informed consent, around a safe environment in terms of infection prevention and control. Those things already exist. They don't have to be laws. We just have to look at the guidelines for doctors and allied healthcare providers, and that should be enough, in my opinion.
Okay, I think that in Colombia, what we did is to put together different narratives for different audiences, and those narratives were created by different people. So let me explain all of that. Part of I think that we had like 3 different narratives. The first one was, without abortion, we will never be a citizen of equally than men in society and in this democracy, because we are not making our own decisions. And all of this narrative was around my body, my choice, my body, my decisions, I decide, no? And that was very important for an audience that was an academic audience, an intellectual audience, like women that were empowered and that were making decisions and wanted like to feel the power that I can decide and be part of this society. But the reality, and this is the importance of intersectionality and conversations across movements, is that my body, my choice is not a reality for all women. And that is a huge lesson. I don't recognize myself as a white woman. I am a Latino woman in this space. But in my country, I am a white woman, no? So the reality is that being able like to have these conversations with other persons was for me crucial in this fight. And women of color, like indigenous women, Afro-descendant women that were part of the conversation were like, my body, my choice is not a reality for us, never. Like this is not something that is gonna get to our audiences, to our people, to our communities. We need to put together other narrative. And the other narrative was around equality, more in who are the persons that are getting to the health services, no? And in which time, no? For them is like abortion, yes, but first health services, and second abortion, and the longest period possible. And that is why at the end, the decision of the court was 24 weeks for abortion under request, because the reality of women that are living in the most difficult areas of the country is that they don't get to the services on time. And when they arrive to the service, they are pushed to another one, and to another one, and to another one. And what is happening during that time is that the pregnancy is continuing. No? So for us, the second one was around equality to get to the health services, and we need a long period of time, because this needs to be a reality not only for women in the big cities, but also for women in the whole country. And the third one was more for lawyers, because lawyers were part of the court and we needed like a narrative for them, and it was more a narrative around criminal code, doesn't work, we need to regulate on their health system. And that was very important for people that was in court and that were like, yes, maybe like the penal code is not that important anymore. The penal code doesn't resolve all the problems. No, like this discussion that lawyers are giving in several spaces, that was another narrative. So I think that we work on those three narratives.
I would say that in Kenya in 2010, we adopted a new constitution. And in that constitution, for the first time, we have abortion protected under when the life and health of the pregnant woman is in danger. And that's in the Constitution. Now, how it got itself into the Constitution is because the anti-abortion groups insisted and put in a clause there that says that life begins at conception. And therefore, we pushed back and we said, it can't just stop with life beginning at conception. There must be exceptions when abortion is allowed. And so if you look at how that section is worded, rather than saying abortion is allowed under these circumstances, it says abortion is illegal except in the opinion of a trained health professional, the life or the health of the woman is in danger. I think the challenge with that provision also is that it vests the power to determine whether to have an abortion on the provider and not necessarily the woman. And the provider must show that the life or the health of the woman is in danger. The reality really is that women who have economic means will have abortions safely, whether it's legal or illegal. And the women that end up with providers or end up in a safe abortion are really poor women. So it brings out that issue of discrimination. But I think the other interesting thing in our own law is the fact that abortion falls under right to life. It falls under the provisional right to life. So it almost seems like it's protecting it, but then it gives these very narrow ways in which it's interpreted. How I would like abortion to be understood, I think it's really important that that power sits with the woman. We don't have that right now. And I think issues of access for us are critical. In our context, mostly in Africa, it's really difficult to sell the narrative of my choice. A few people are saying it, but it's something that is resisted. It's seen as a Western thing because, we come in with that community angle to things. And so finding narratives that can sell to our context is very critical for us. I think the last thing I will say is that we are now seeing a trend in the region where a lot more countries are trying to have abortion, life beginning at conception enshrined in their constitutions, such as Zambia. And I think that's a really dangerous ground that we are working on. Thank you.
I'd like if you could each briefly share with us how you started in the work that you're doing, but then also a couple of you have also, you all mentioned at certain levels, then collaborative work you've done with other groups and how you both see sort of work you do with other groups, both maybe it's short-term work and also like the long-term, how hard it is to sort of continue long-term, both with your own work, but then also collaborative with other groups. So first, if briefly you could share why you entered the work, and then second, the difficulties of maintaining sort of long-term, whether it's solidarity with just one issue, or larger sort of groups about larger healthcare access issues.
The first thing to say is I remember really clearly the first time I was standing in a room and I heard somebody say the word abortion, and I was in my probably about 26 or 27 at the time, and I was absolutely shocked because it was just an absolute taboo in Ireland at the time. And that was within a left-wing political, grassroots political party, political movement that I had joined. So that's where I first became involved, and from that shock came my own my own confidence to start speaking the way I was seeing some of these other people speak, and being really, if they can speak like this, I can too, and really finding the confidence to participate in public meetings, put up my hand from an audience like this sometimes and start making contributions. So that was the first time, I guess, I became involved. But when I became very actively involved in the campaign in a different role was in 2015. I think I said earlier, my discipline is adult education. So I would have been involved in writing. We used to do these 6-week courses for that would be delivered to women's groups. The idea began in Northern Ireland and then spread to the Republic of Ireland, of really just getting people comfortable about talking about abortion. I mean, basic stigma busting stuff was how I got involved, sitting around and getting people to begin to use the word, begin to talk about their own experiences, begin to talk about the impact of the ban. And that's how I got involved, was that slow work of convincing other people. So, it can be very intimidating being surrounded by lawyers who talk about all the courtroom dramas that people are involved in. But for me, it was with women's groups. It was trying to get people, it was really consciousness raising education is what I would call it as a feminist. It was really getting people to understand the dangers of an abortion ban, to normalize abortion. And that is something then that I would have continued to do through, there was an organisation in Ireland called the Abortion Rights Campaign that were really very influential. Even their decision to put the word abortion in their title was very deliberate, but very controversial. So I would have got involved in helping organise what was called the March for Choice. So the first March for Choice in Ireland began in 2012, and it had about 2,500 people on it. By 2016, and if you remember earlier when I talked about how small Ireland is, by 2016 it was 65,000 people were participating on the March for Choice every year. So I would have been involved there in recruiting, spreading the word, stewarding on the marches, that sort of thing, and just been really involved in that grassroots work. I also would have been involved. One of the kind of key things that happened in Ireland was the decision to take the campaign from a kind of a central Dublin-based headquarters and really spread it through the periphery of Ireland. So I would have been involved in a group called, I think it's called Dublin West for Choice, I think we were called. And just trying to get, I remember, again, speaking about one of my kids, bringing she was 16 at the time, bringing my daughter in, and again, just normalizing the conversations. So a lot of my work was that kind of grassroots work. And just to pick up on something that Catalina said earlier before it gets lost, the key thing that worked in Ireland in an incredible victory in 2018 was that piece about linking the movement. So liberal feminists working with socialist feminists, working with queer activists, working with as broad a platform as possible. So people who had not been on the same side 10 years earlier, getting on the same page. This jumper became massive all over Ireland. There was a broad-based movement called Together for Yes in the last year. And I honestly think it was that thing of getting on the same page that really made it, brought the victory in the end. And the anti-abortion movement never did that. They were squabbling with each other right up until the end. There was all sorts of mixed messages. Now, it wasn't a perfect campaign because we were under the one umbrella. One of the things that my own research has kind of brought to the fore is that a lot of people, including myself at the time, I remember, we weren't happy with the messaging. So the messaging was my body, my choice, and a lot of us weren't happy with that messaging for all of the reasons that you've identified. It was a very white middle class message because that was seen as being what was needed to get it over the line. So then we had groups like migrant rights organizations, in particular disability organizations, saying, you know, where were we? Why were we suddenly hidden away to get this campaign over the ground? So that has been a lot of the reflecting in Ireland afterwards. And I think for me, it's about good faith reflections, which say, okay, let's learn from that and let's do better the next time. And bad faith reflections, where people just diss the whole campaign and say feminists can't lead anything and what a terrible time it was. So I think engaging in those good faith reflections is really important. But I've kind of gone off the point, which is really just that my work was in the grassroots with ordinary women, knocking on doors and just trying to convince people that a constitutional ban on abortion is no place in a civilized society.
Thank you. So I am going to start with the last part of the question, that is movements and how we can continue working together. And I don't want to leave the message here that everything was perfect and that we worked very well together all the time, because that is not true. And it is important also to recognize that. Like working together with movements is very complicated. It takes time. It takes a lot of political willing. It takes a lot of efforts to organize, to have conversations, to have difficult conversations, to meet. It requires funds. It requires resources. It requires a lot of things. And I think that to continue those efforts of being able to create strategies together, we need to be very aware that all of what I already said is needed. Like, we need time to concentrate on that, to create the political relations, to create the political construction, to meet, to have the conversation. Like, only to have one national, for example, one national meeting with activists across one country is a lot of efforts and a lot of money, you know? So that is very important, and I think that is something that I try to talk a lot with my donors, for example. Like, this takes time, and this takes, like, this is the formula for success, but this needs, like, these encounters and these kind of conversations. So going forward, we need to continue, like, putting a lot of efforts on that. And how I entered the repro world, I did the law school. I am a lawyer. And when I was at the law school, I was already like a student leader, but not in feminism. I was working in Colombia for peace at that moment, and labor rights, and also I was organizing mobilizations against trade agreements with other countries. At that moment, I was like, that was like my political soul. But when I graduated from law school, I started working in the human rights field. So I worked with the UN for some years at the field in Colombia, in areas that were very complicated at that moment, but that for me was like the best experience ever. Then I joined the Inter-American System on Human Rights. I worked there for 5 years as a lawyer in Washington, D.C. And then I knew the work of the center, like, because the Center for Reproductive Rights, maybe you don't know, because the majority of the work that you know from the center here is the work that we do at the US, but the center has this global work that is very important and relevant. And when I was working at the Inter-American Commission, I got some cases from the Center for Reproductive Rights, and I started to get to know all this world of repro, and I really felt in love of repro rights movement, and I found my place there, and because I was already an activist in my country, I decided that I wanted to do that, and I joined the center years after that. That is how I joined this world.
How I started working on abortion. all my career, I have worked on women's rights in some form, and particularly targeting poor women. And so when I worked for the Federation of Women Lawyers, which is an organization, a national organization that is the organization that is known to have pushed the envelope the most in Kenya and tackling all the the taboo issues. That's where I got my interest, and particularly because even within that very progressive organization, abortion was a taboo topic, and not many people wanted to tackle it, and so I was assigned there, and then I just gained interest in it over time. Now, working with other groups, I think it's important that we work with groups because, one, there's strength in numbers. And when you are working, as a collective, it's easy to diffuse the targeting of because if you are alone, the anti-abortion groups will easily target you and can finish you in so many ways. But when you have a base that supports you, you are a little more cushioned than, you're not as exposed as you would be. But I also think that, working as a group, we are able to bring in diverse expertise. There will be those that are researchers. There'll be those, that are community mobilizers, litigation, communications, because no one organization will have the strength in all these fields that is needed. And so it's important that we come together and we leverage that. I think also it's about leveraging resources. As Catalina has said, there's only so much resources out there to be able to do this. And so when we can each chip into the basket, it makes it a lot easy. But to also just emphasize that it's not easy. There's a lot of competition for resources, and it's difficult. You must be very intentional about it, about meeting, and I think convincing the funders that this is really important and the way to go, because I don't see a situation where abortion is not going to be a contested issue. We are in it for the long haul. It's a fight, and some of us will leave this space, and there will still be others to join, and the fight must continue. Thank you.
I'm going to open it up to the audience now for questions. If you guys have any questions. Also to note, if you don't want to vocalize your question, I believe that there's notepad or there's index cards on the back if you want to write down your question. I can read it. But if someone wants to ask a question right now, please. Yeah. And we need to wait for the microphone, I think, though. Yeah.
Thank you, and thank you so much for these wonderful interventions. I wanted to pick up on something you said about evangelicals and their coordinated efforts across space. I think the one thing that I would hope we could get more into are the political specificities. I should say I'm Ann Orloff. I'm a political sociologist, and by courtesy in the political science department here as well. Because the anomaly of the US is not just public opinion. I think it really resides in very specific political institutions which give power to anti-abortion forces who are also, arrayed on a number of other political dimensions around democracy and so on. And this is actually a global fight, as you well point out. That there's a global coalition against abortion rights access and against so-called gender theory and so on. So I think that in a way, the reflexive thinking, which I will say I fall into too, is to say, this is science-based. We have the massive population on our side. Why can't we win? This is for a US person. I think is because we are up against a different kind of political movement that is not just about winning hearts and minds. It's about winning power in very specific political places. And the US political structure, unfortunately from my point of view, amplifies the power of these kinds of forces. And I think the kind of power that these forces have in developing countries that depend on aid is a piece of this as well. And so I think that the sophistication of our analysis around the movements is great, but I think we need to invest as much investigatory energy into the antis and really getting into that. And I think there are some pieces of this that maybe are difficult to talk about. Maybe things like, is Catholic ideology the same as evangelical ideology on these things? Where do you see, possibilities for winning people over? And they may differ depending on the kind of doctrine that people are following. Thanks.
I just love to make one point, if that's okay, because I hear you, but I personally think that we need to put pressure on our politicians who are listening to these people. Why in Ireland, for example, was the Catholic Church allowed to wield so much power? Why does that happen? I mean, my own kind of sociological analysis is that ultimately the end goal of preserving the nuclear family also works for neoliberal politicians. So they will go along with all sorts of stuff that they mightn't even believe. So in Ireland, we would have a very liberal centre-right. For example, before the abortion referendum, our Prime Minister was a migrant, he was a person of colour, would have been very liberal in many ways, but he was gay, married to a man, but he still would allow incredible things to be said and done by the Catholic Church, and it's happening with the far right in Ireland at the moment as well. And I kind of don't care about what they think. I think we need to put pressure on our politicians to say, why are you listening to these people? Why are you giving them this platform that does not represent the majority of opinion? Because every time the Irish people were asked to vote, they voted for the most liberal option that was put forward for them, every time. Except for in '83, which was, it was a very low turnout, and it was 53% was the victory. But that's where I think we need to be asking the questions. Why are you allowing, in Ireland, it was mentioned with Poland earlier, the Catholic Church still control 80% of schools in Ireland. This is an organisation which has had incredible abuses being uncovered, organised paedophile rings, horrendous assaults on women, and they still manage to hold some sort of moral authority. And that just baffles me, to be honest, baffles me.
I think I want to agree with you that we need to invest a little more in understanding how these people are operating, and really in demystifying some of their narratives, because some of them, when you look at it, is actually contradictory. But I think in our context, we have not necessarily really understood, especially these evangelicals, what they stand for. Sometimes on paper, it's very different from what they do in practice, because some of those churches actually allow for abortion under certain circumstances, but then they come with this sweeping force, which makes me wonder whether it's really about their religious ideologies, or it's about something else. It's about power. But what I also see as very problematic in Kenya is how much they have penetrated the government, whether it's the Ministry of Health. They are sitting there as advisors. They have direct ear of the presidency. And it's challenging, because we have reached a level where, for example, the Ministry of Health will disregard its own policies to align with these people. And so I think we must also push back on the government, because the ultimate obligation is with the government, and yet these people have sort of infiltrated and are kind of controlling them, to the extent that even the court, in our case, took cognizance of the fact that the Ministry of Health seemed like a little baby in front of these people, because they were swaying them as in contradiction to the ministry's own policies, which I think is problematic.
And maybe just to add something, and is that in Argentina right now, they voted for even with this huge win 2 years ago and with a social decriminalization on abortion that is very present in the country, like the majority is in favor of abortion, etc., they voted for this president that is like a mini Trump in Argentina, which is Milei. And I was in Argentina 2 months ago, and I was talking with an Argentinian activist, and I was like, why this is happening? Like, why this is happening if we had majorities 2 years ago in Congress, in the executive, in the streets, no? And something that we were, I don't know if this is the answer, but something that we were discussing at that moment is that when the politicians from the opposition talks about these issues with people, they are not saying you are in favor or against abortion. No, they are saying you are in favor or against family, you are in favor or against your pension, your health coverage, because at the end, when the government is taking care of gender and abortion, they are letting go your pension and your health coverage because this is not longer a priority. And that was the public conversation in Argentina. So people are like, no, I want my pension, I want my health coverage. And regardless if they agree or not with abortion, they are gonna vote for the person who is saying, I am gonna guarantee this for you. So I also think that analyzing the narratives of the opposition is very important, and also analyzing what is missing from us in the narratives as well. How we talk to a society that don't know about abortion a lot, and that have other challenges in their daily life. How we get to that people. And I think that is my obsession right now, like how we can talk to that people that have these challenges each day so that they can vote for like the people that we want in power that have a democratic agenda.
Is there another question?
Thank you. Hi, my name is Alexia. I'm a journalism student currently at Medill. Thank you so much for bringing this conversation and your insight to this space and to this campus particularly. I sort of wanted to go a little bit back to the point that you made on framing the arguments of the movement, specifically for Savita Halappanavar in 2012 in Ireland. A big part of the arguments for abortion access was actually in support of life, that being the life of the woman, and not so much, the argument for choice. You also talked about, Catalina, about different arguments that convince different audiences depending on their background. My question was, do some arguments that we base abortion access on play a bigger role for the movement than others, or are the arguments simply a means to an end? In other words, is the priority the reasoning behind increasing abortion access, or are those just a means to the end, irrespective of how we are actually convincing others? Thank you.
Yes, so Savita Halappanavar was a migrant woman living in Ireland. She was a dentist. She was admitted to a hospital in Galway. She was actively miscarrying, but there was still a fetal heart rate. And she was, actually, even though I never met Savita, I think for a lot of people it really kind of signifies the movement in Ireland. She repeatedly asked for an abortion, as did her husband, and was repeatedly denied. And at one stage, she was told it was because Ireland is a Catholic country. So she did become very much the symbol of the movement, and it was very much where people could suddenly see that ordinary women in their lives could die, that this was, and her family were, really brave to allow her image to be used. Her husband did multiple interviews. There was a journalist called Kitty Holland who broke the story. And I think this is a really important part about journalism, because there was probably other Savita Halappanavar's, but Kitty Holland broke that story. And that was the difference, and has broken many stories in Ireland. But it is also important to say that when she died in 2012, That was one of about 4 or 5 things that happened in that year as well. There was already some momentum building around politicians, socialist politicians. We have a very different political system than your two-party system. So we would have had socialist politicians who wore this jumper in Parliament. A socialist politician had already introduced a bill, knowing it would not get passed, but just to bring the debate into the fore. There had already been a mass meeting because it was 20 years since the X case in Ireland and still no legislation had been passed. And there were a group of women who formed an organisation called Termination for Medical Reasons, who went on television in Ireland and told their own stories of travelling overseas for abortions. So Savita died in November. Most of those things had happened before that, and the first March for Choice was in September. But absolutely, I think her death completely changed the tone of what happened in Ireland. I know I'm probably taking too much time, but just to say, as somebody who's kind of researches feminist movements, one of the problems now is that when people write about the Irish story, they begin it with Savita. So even a leading historian in Ireland called Dermot Ferreter has just written a book kind of about the last period of history in Ireland, and that's where he begins the story. And I would say that the story began in the 1980s by grassroots committed feminists. Absolutely, Savita changed things, but the movement was there before that. Sorry for getting emotional. It's just it just sparked something in me there. Thank you for the question.
I actually think we're out of time. So I'm sorry we didn't get to all the questions. Hopefully this afternoon, some of the questions that didn't get asked can get raised during our afternoon discussion too. But thank you again to our panelists.
And just to say that we will be back I'm now not looking at at 2:00 for a roundtable, bringing together all of the panelists whom you have seen, with plenty of time as well for question and answer. And after that, there will be a reception. So thank you all for being here, and thank you to the audience. We will have much more time as well for audience questions. The way that we're going to run this final session is to allow some time for the speakers to ask each other questions and follow up on some of what's come out of this morning's sessions. Thank you to our 2 moderators. Thank you, Sarah, and thank you, Katie. And I'll just get the ball rolling by asking a few questions, and then you all pitch in, because I feel like there's a lot that's come out that you will probably want to follow up on with each other. So I want to return, if I can, to the question of international involvement in these questions. That's something that Evelyn has raised, which is the role that American evangelical groups played, and the way in which the global gag rule, even when it was not officially in effect, nonetheless had a chilling consequence. So the story that Evelyn told in the morning, if you weren't here, is in 2013, during the Obama administration, that there was a fear of USAID becoming involved and with Kenya's new rules and regulations on abortion procedure. So I guess just to put to you, I mean, one of the things that we've read a lot about in preparation for this symposium, for instance, were Russian disinformation campaigns around abortion and the way in which abortion functioned like trans stuff for Russian actors, with Poland as the center of that work. So I'm just wondering, to what extent do you encounter this? Is this, other than perhaps the global gag rule in the US government, is this a boogeyman or is this a real thing?
I will say that in terms of the US foreign policy, what we have seen with the global gag rule and even the Helms Amendment, when we have administrations in power, the Republicans particularly, that promote these policies, and then we have seen the Democratic administrations come in power, the impact of these policies is beyond particular administration. When we had, in Kenya, when we had USAID advise Kenyan actors not to attend the Ministry of Health meeting on health, this was in 2013. This was actually Obama administration. But the impact of what had happened before was felt for years. And I think that's the same thing we've kept on seeing, even now with the Biden administration that rescinded it, the impact is still felt. Part of what we have also seen is when these policies are in effect, organizations that ordinarily receive US funding have tended to self-censor. So they will interpret it in a more restrictive way than it actually is, because of the fear that they would otherwise lose the resources that they depend on. And we have seen that the impact is beyond abortion, because these facilities are the same ones that will be offering, whether it's cancer treatment, broader reproductive rights issues, HIV. And when they close for all these services, not just abortion services. And so I think it's important that we are reflecting on this and how it impacts our access. Because our government, because of the funding that we receive from USAID, and it's actually the biggest development partner on health. And so what they say, what the policy is here really affects access for us. And then finally, I would say we are seeing a lot of disinformation and misinformation campaigns that are spearheaded by these anti-abortion groups. And then, well, we have the evangelicals from the US, but we also have some of these groups, even from Latin America and Russia and all of this, organizing and using a lot of misinformation and disinformation and targeting even legislators that are trying to promote change of reform to laws. And so I think we will still see more of that. The thing is for us to also organize to challenge some of this misinformation and disinformation, including with evidence and narratives that speak to the common, the general public. Yeah.
No, I agree with what Evelyn already said, so I am not gonna repeat. I am gonna add three thoughts on this. The center, for example, doesn't receive funds from USAID, but a lot of our partners in the region do. And when the gag rule came, and years after today, we have seen the impact of how that money don't get into the region is impacting the work of national organization through the region. And I think that I want to highlight two things there. The first one is the other champions that came to fill that gap, no? Like the US is not giving this money anymore. There are many organizations that are not receiving funds. We need to step up and fill the gap. So many countries did that. For example, Canada, the Swedish government, France, many countries came to a region to fill that gap, and I think that that is important to mention. And just to end with a reflection on also what does it mean to receive funds from a government against receiving funds from foundations or a private or individual donors. And I think that governments have a lot of restrictions today to give their funds. And these restrictions are very complicated for many organizations that are doing the work at the field. There are small organizations that don't have all the things that governments are requiring for them to give them directly the money. And this is creating a reality in the region, that is that national organizations or grassroots organizations are not getting the money directly, but through other big organizations, no? And this creates a quite power dynamics in the region that we need to be aware of that. And this is part of the reality of the work that we have. And the second thing is that when money is not that restricted, it comes from foundations, for example, I think that first, there is the possibility for small organizations, or more possibilities for small organizations to get to that money directly. And second, I think that it comes with less restrictions in terms of strategies and in terms of what we really need to do, no? And the words that we want to use and the strategies that we want to create. And there is more freedom and respect on the knowledge than organizations from the countries have in how better put together strategies. So I think that funds also, it's not only about funds, it's about power dynamics.
I think on the question of disinformation, I actually wanted to bring in another dimension to this, which is actually the role that non-state actors play around disinformation as well. So I think we often think about disinformation, and as you spoke about, we think about government interference in elections and things of that sort. But I think we also have to think about the role that tech companies also play in misinformation and in what information they are overtly or indirectly censoring on their platforms. So there's a coalition here in the US led largely by Amnesty International US that really focuses on the censoring of evidence-based information on abortion on platforms like, largely Meta-owned platforms, on platforms like Instagram, Facebook, and others, that really look at organizations that are trying to counter the disinformation that people are getting about abortion care, who are then finding that the information they're trying to disseminate is instead being blocked on those platforms. And I think just as we think about disinformation, as a human rights lawyer, a lot of my work focuses on the role of governments and on state actors, but it's really important, as information is more democratized, to also think about the other gatekeepers that are private companies as well. That's what I would say.
I will not speak about funds because we didn't receive funds from US government for Poland, but I would like to speak about the role of Catholic organizations, fundamentalist organizations, after the judgment of US High Court. They felt stronger. They received more money. They established a new TV station. They opened the Institute for Anti-Choice, pro-life, I don't use this, for anti-choice lawyers. They were everywhere, in every ministry, in every institution, and also in parliament. This was disappointing for Polish massive movement, pro-choice movement, because we didn't expect such development, such situation. Of course, the small balance was made by France. As you probably know, abortion was included into the French constitution. It was the France answer for the situation in the United States. But anyway, we stopped for a while doing our job. We stopped our advocacy work because we have to strategize and have a new strategy how to oppose growing fundamentalism in our country. And this is extremely important, not only for Poland, but for the region, Central and Eastern European region. Poland is a well-developed country, and this is the example for neighboring countries. Example on UN level, in European Union, and for their own economy, for example. So this country look at Poland very carefully, also regarding the abortion in Poland. And we are afraid that the whole region will be just demand to change the law. After this short period of disappointment and fear about this, what happened, it was the same situation as in Poland. The Constitutional Tribunal changed the law, and here the High Court also did the same. After this, we work on a new strategy, how to oppose them, how to change this misinformation from fundamentalists, and still we are continuing this work because they use the false information, share this among young people, among young generation, and we have many troubles to oppose this language. They overtook the human rights language, of course, our language. They are strong also because still Holy See is the permanent representative for the UN. I don't know how it happened, but it happened in 1964. It's the only one religion which is represented within the UN institution. Why? Could you imagine why? So right now we are standing in solidarity with American women, and we keep our fingers crossed for the result of election. This is extremely important for us because I'm afraid of the worst scenario in Poland that some politicians declared that Poland will be the first country in the world with a total ban of abortion. And other countries, surrounding countries, neighboring countries, will take example from Poland. So if you fail in elections, I'm afraid that we also fail in the next election in Poland. So these democratic rules we have right now, there are many, differences between 5 parties which are engaged into this coalition, bigger or smaller differences, but we can talk, we are listened to. Previously, we were totally neglected. No answers, no phones, no answer for our statements, for our letters, no. Right now, we are a partner in discussions on this. So at the end, I just would like to repeat that keep fingers crossed for the US election, of course.
I would just like to, I know we don't have to go along for everyone, but I would just like to make a point on this about messaging from the US into Ireland and how it can backfire. And I think there are 2 examples in the Irish pro-abortion movement of when this happened. So the first was in 2012. We talked about that as being a key year already. One of the kind of the history of the abortion rights campaign was US-funded poster campaign by a group called Youth Defense, who out of the blue launched a national campaign of posters, which I now realize from talking to other panelists at lunch are quite common in some states in America, but certainly were not in Ireland at the time. So the graphic images, I think abortion tears her apart was the tagline. And they really, really misjudged the national mood. And that action is often linked to really the growth in the pro-abortion movement. So it was a massive own goal. And the second time American messaging resulted in an own goal was in Ireland. We had a thing called a citizens' assembly. It can sound different, kind of strange, I think, in other countries where 100 random citizens are chosen in Ireland and they're brought together to discuss a topic, be it the legalization of drugs, be it abortion, as was the case in 2016. And the citizens' assembly people can stand up and address this 100 people and put their side of the story across. And the anti-abortion movement chose to invite two high-profile American medics, I don't know their names, I'd have to look it up, who told horror stories, really graphic stories. I think one guy has worked as in an abortion clinic for years and has very much changed his tune. And it completely backfired. It was a dreadful idea that really played into the hands of the pro-abortion movement. Had they done what the messaging up to that point had been, erroneous stories about regret, which do tend to carry a little bit more weight, and had they gone with that, maybe the result would have been different, but they decided to go with the graphic images, with the horror stories, and people in Ireland just didn't buy it. It just didn't work.
One of the things that's so resonant about the Polish case for Americans is, of course, precisely the regression. So a long-held right that is built into the society and the economy is taken away. And I'm wondering, Christina, if you have advice beyond elect a president who's, supports abortion rights, if you have advice for young people in the audience, having watched that same process yourself.
My general advice is to continue fighting and continue education of the elderly population, of course, and just believe in these basic human rights that we owe our body. Our privacy and our life belongs only to us. So don't allow them to change something and act locally with others. Just to tell them that this is not the problem of ideology, of religion. This is just problem of health, of healthy life for women and their families. Stories are used, but maybe the word story is not accurate one. I think that better just to show some examples of the anti-abortion law. As I am sure that Savita helped Irish women. Her portrait was on every street, everywhere. This is very sad that we have to use these really sad, awful stories to fight and to regain or to gain reproductive rights, especially abortion. But we have to show them. We have to show them that they kill women. We are not a killer. We are just real women living in the country with no access to basic reproductive health services, to abortion. So just remember that this is your future fight, because we women, we were born without human rights. And from the very beginning, we have been fighting to regain our rights, rights to vote, rights to our privacy, to secure our health, against discrimination, because lack of access to abortion is also institutional violence against women, as well as discrimination in equal access to health services.
Can I come in one more time? And I want to give you all some time to ask each other questions, but part of the dynamics, it seems like we've been tracing both in restricting and expanding access, and then, of course, the ambiguities of that, is the delegitimation of major governing institutions and being able to take advantage of that. And whether that seemed to be playing somewhat in what Evelyn was saying, especially last night, and what Catalina was saying as well about taking advantage of the moments of weakness where people are questioning, where does this government actually stand for me? And that's certainly the case with the Irish Church and all of its scandals. And I'm wondering, so what do you see those opportunities as being? Is that a correct characterization? It's the moment when the people who are opposed to abortion rights, or the institutions that are opposed to abortion rights, have lost pretty significant legitimacy, quite separate from this issue.
Yeah, that is true. In our case, I mean, I spoke in the morning about how the anti-abortion groups have infiltrated, for example, the Ministry of Health, to the extent that the government is not standing by its own policies. We, on this other side, are more of supporting government policy, and the government is taking a position as though this is not their policy, but it's not even supported by their own data that they're having. And I think one of the things that we really must do is begin to interrogate the narratives that the government is using for not standing by its own policies. I think it's a tactic that now the anti-abortion groups are using more and more. And what I also see is a lot of blackmail of key leaders within government. So they will threaten you, to mobilize against you so that you're removed. And we've even seen instances where government officials that support abortion have sort of been demoted and taken to head. For example, I know of an instance where one was taken to head a small mental health facility from being a very senior government official. So there are all of these ways in which they're trying to punish those that stand. And we have to figure out ways for us in the movement, how do we support these government officials that are standing with us? How do we ensure, how do we cushion them so that we are not, advocating out there and not cushioning them so that they continue to, stick their neck out there for us, so to speak. Yeah.
I'm still thinking. Anyway, I think it's an Irish question. Okay. Yeah, Caitlin, go ahead.
I'm just going to say, I think delegitimizing is really interesting because there's lots of different ways that can happen. So, for example, you're seeing this internal fight right now in the Trump candidacy, where they're in this back and forth battle where he's saying, well, no, I don't support a national abortion ban. And at other times has said, yes, I think we should, there has to be a penalty for women who obtain illegal abortions. And then, the pro-life movement is saying, oh, no, that's not the talking points, you're messing it all up, and we're not gonna vote for you if you're not so strict on an abortion ban. So I think that, I hope, highlights how illegitimate their movement is in terms of that there's not, that there's no, so how hypocritical it is, the way that they're, the messaging and the actions and what it actually means for, people who are having abortions and needing abortions and performing abortions. And at the same time, I worry about the delegitimization of the political process writ large, which is, look what you've done to us. You've let women in, red states just fend for ourselves. We have nothing. We don't have physicians standing up for us. We don't have our politicians. We have to go and order abortion pills online in order to take control of our own bodies and our own rights. And so I'm just not going to get away from it altogether. I'm not going to vote. I'm not going to engage. And so I worry on that side that we're, because of that alienation, we're actually going to lose voters in this upcoming election.
Yeah, I mean, what's coming to mind, I guess, for me in relation to the Catholic Church in Ireland is just to look at the difference between the campaign in 1983 and how it was completely dominated by the Catholic Church. Masses, sermons every week, in schools, in colleges, everywhere, and it was very much a Catholic message, compared to 2018 when they were completely silent, really. There was nothing. There was, I think, a letter read in Mass, that's what we call it in Ireland,
And that was about it. The Catholic Church was largely silent in 2018 because they had lost their moral monopoly in Ireland. There is no doubt about that. They had, I mean, Ireland, I think you would have to call Ireland a secular country now. I mean, the majority of people are still classified as Catholic, but that's mostly so that you can send your kids to the local school rather than that people practice. But I don't trust the Catholic Church. I think they have a long history. I think it runs very deep. I think they're particularly going for trans rights at the moment. We have some really terrible statements coming out of the Vatican there. And I just think we need to remain vigilant. We need to remain ready to mobilize at any stage, because I think the Catholic Church in Ireland will be back. At the moment, they're trying to get their claws into our National Maternity Hospital with religious ethos kind of stitched into company, to the memoranda of the company who's going to be running the hospital. So we just have to stay vigilant because they will be back.
Questions? Yeah, it's the same in Poland. When we are thinking about anti-choice groups, usually we join them with religion. This is not the truth. It's not only the religion. It's also the fight against democracy. It's a fight to strengthen patriarchal system. It's the fight to change the position of women, just to push them again, let's say, into the kitchen. So just remember that right now it's in Ireland as well, in Poland, the position of Catholic Church, it's not so strong. They kept silence during the introduction of drafts law on liberalization. They didn't answer on this. It is the same right now. They are afraid because many stories came into the light. Pedophilia, among others, some kinds of other crimes, money, they are still paid by government. So we continue to fight to withdraw these funds which supported their activities. The religion is limited right now. A couple of months ago, students have 2 hours of religion weekly. Right now is 1 hour. And the decision that the religion will be moved to the churches, not in the school. So it's again Catholic Church. They don't want to agree on this. But I think that it's worth to remember that this is not only religion. This is just the future word. We have 2 different positions on the future: democratic word or fundamentalist word with patriarchal system.
Okay. Yeah, I want to give, go ahead.
I'll just regret it if I leave today and don't mention the fact that the Catholic Church in Ireland were responsible for incarcerating around 100,000 women in the 1900s in Ireland, in my generation, in mother and baby homes and Magdalene laundries. The last mother and baby home closed in 1996. This is very recent history. And I think that is a big part of the fall of the Catholic Church in Ireland. They locked women away who were pregnant, and most of them were pregnant from sexual assault. Well, certainly a good percentage. We'll never know exactly how many. But this is a big, and these were nuns. These weren't priests. These were women. These were nuns that principally ran mother and baby homes and Magdalene laundries in Ireland. I just wanted to, in memory of those women, just mention that before today ends.
It's important.
No, just about religion. Colombia is a secular country, but in reality, it's a super Catholic country. Like, our culture is super Catholic, and our popular culture is hyper Catholic. Like, even people that said that they are not Catholic, they are still thanking God for everything. So yeah, no, and that's part of the culture, and taking that into consideration, One of the things that that we tried to do also during the public conversation was, we need to face that reality, and we need to understand that we are talking to a society to whom religion is important. And because that's what it is, part of what we thought is that we needed like to join efforts with that progressive part of the religion that are like in favor of our rights, that can talk from their faith to society. Because at the end, I think that a normal citizen, a person that doesn't have an agenda behind, you know, like a normal citizen that is Catholic or that grew up with this culture, a thing that he is asking himself is not, oh no, they are using religion in politics to go back rights. No. The only thing that they are asking themselves is, I am doing something wrong, like I am gonna be like, what does this mean? Like I am gonna be punished or you know? So I think that we need to get to that people, no? Or if I believe in God, can I also support abortion movements? Like those are the kind of questions that they have, and we need to be able to respond those questions as well, no? And not to put them in the other side of the conversation, because if we said each person that is a Catholic person or that profess a religion is in the other side of this fight, you are putting away, in my case, the majority of the population. So how we can make them part of the conversation? And I think that is also part of how to create narratives for societies, depending on the context.
Are there questions that you all want to ask each other before we head to questions from the audience? Questions that have come up over the course of the day? If not, we will just take a few questions from the audience and we can pong back and forth. Oh yeah, go ahead, Caitlin.
If nobody else has one, I would just be interested to hear in other contexts in other countries how physician advocacy has played an important part in that, because I think we hear a lot about how physicians can be gatekeepers and can turn people away and shame them and report them, but I'm also interested to hear good stories.
Yeah. In our context, we have worked with a few physicians. I think it is fair to say that physicians don't ordinarily want to be advocates of this issue. They just want to provide services and let others do the advocacy. But we've found it really, really important to have physicians as advocates in addition to providing the services. Because first of all, the anti-abortion groups are investing in physicians as advocates. And so when they articulate these issues from a very medical perspective, and if I am on a TV station, for example, as a lawyer, and I am trying to challenge a doctor on a medical issue, nobody will believe me. I think it's important that we work with physicians, first of all, to build their capacity as advocates, because you want them to pass messages that resonate with the general public. And so framing in simple ways that the public can understand is really important. And also I think really because of the emotive discussions around abortion, it's really critical that we arm those who support abortion with the messaging that allows them to speak in ways that resonate with people. We have seen physicians also come into court as experts. And I think I would also say that the physicians that we have worked with have also been targeted by anti-abortion physicians to the extent that some of them have almost felt like they were not provided as much support as they needed to. So I think it's working with them to build their capacity as advocates, but also cushion them against attacks from their peers. Yeah.
Yeah, In Colombia, we worked very close with physicians for the criminalization of abortion. And of course, they are key allies. Like, we cannot do this work without physicians. They were part not only of the service provider part, of course, but also they were advocates. Some of them signed the case before the court. Some of them support us in writing a lot of the arguments. And they became very active in communications, press, media. Like, I remember that if we were invited to a TV show to talk about the case that was before the court, we always were in group, no? So the lawyer, the doctor, the Catholic, and we had like this interdisciplinary pool of spokespersons that were responding from each of our fields. And at the end is also like to be able to do pedagogy, because when you are giving an interview, when you are in social media, when you are making pedagogy for the society. So you need different voices there as well. Yeah.
So in Ireland, there was a group called Doctors for Choice. It was one of the earliest groups to become established. And a bit like what Evelyn is talking about, it actually gave cover then for individual doctors because nobody's name was associated with it. And they were really active and really influential from very early on, releasing press statements, commenting in the media. And they're a big part of the story in Ireland. It's definitely is Doctors for Choice.
In Poland, we have now the support of physicians, not at all. Just a small group who collaborate with us. But generally, they keep silence. They didn't oppose, but they also didn't help. And this is the huge education among the medical society right now. We have started to educate them, and even we promise them to invite Irish Doctors for Choice to show them the good example on influence of medical staff into the change of the law. But generally, they are not interested in women's rights and women's health.
Yeah, of course. Maybe if I could ask any of you to share with us, what are some of the creative strategies that you're seeing being deployed in the environment where you're working, or anywhere really, things that we can learn from and maybe try and test in our own context?
You know, strategy, there is no one strategy. Just strategy consists of several different kinds of strategies directed to different group of people. But generally, our feminist strategy is to help women. So we do this, and government and politicians know about this. But still, sharing information is not punished in Poland. So usually we just base our help and assistance as sharing information. Our main strategy is directed to politicians, is the sentence that no one more. It means that no one more will die because of restrictive law. And we are doing abortions. And when one of us was punished by sending pills to a woman who was a victim of sexual violence, of her husband, of course, she was pregnant, and it was a time of pandemic. It was very difficult and long wait for the post to receive pills. And one of the activists just sent her. And husband of this woman announced this to the police station. And there was a trial. She was punished. But thousands of women sent via Facebook I am as Ivona. I will do the same. I did the same. I do the same all the time. I live here, please imprison me. Take me into prison. We will go, all of us. Just please build the new prisons, because thousands of women help each other. So I think that the most important weapon, which should be treated very delicately and built stronger, is the solidarity, is the women's solidarity. This is the greatest weapon. The governments, politicians, they are afraid of the power of women, you know? They were hidden during our black protests. They were hidden somewhere. They sent police on women with gas on some other weapon during the pandemic. But we came out. Thousands of women came out in 2022 when Constitutional Tribunal changed the law, just giving the sentence that abortion because of fetal impairment is against Constitution. A part of the pandemic, a part of the we are closed, we came out. Thousands of women, not only in Warsaw, but in almost every city. We came out and said that we are doing abortions, we will be doing, and we will be helpful each other.
We touched on this a bit earlier this morning, but I think also one thing that the Center for Reproductive Rights has been doing in the US in particular is filing cases on behalf of individual women who have been harmed by abortion bans, particularly people who needed access to abortion care for medical emergencies. And I think one thing that I've really seen from those that I think is not quantifiable is the way that that's been shifting the narrative around. I think we've been saying forever that abortion is a form of healthcare, but I think it's actually in a lot of ways changing the way people think about abortion as a form of healthcare, as not just a form of healthcare that some people need and not others, but like in fact that anybody who can get pregnant in the way that people who are carrying wanted pregnancies can also need abortion care, and also can need it in a way where they need it instantaneously in order to prevent lifelong harm to their bodies or potential death. And I think even though the cases, for example, that we've filed in Texas have not been successful, and the Texas Supreme Court does not seem to care that women will die as a result of their current abortion law, I do think it has been really effective in just changing the narrative or people's perceptions of the actual harm that these laws are causing. And I think I encourage all of us to continue to be brave in thinking about advocacy strategies that may or may not resolve in incremental concrete gains in the near term, but can do what Kata, I think, put so beautifully as socializing the concept of abortion and destigmatizing abortion in that way as well.
I mean, I really agree that certainly in Ireland, legal cases did have a big difference. But what I would say in answer to your question, Evelyn, is civil disobedience and visibility were the two main things in Ireland. I think of things like when Twitter was a thing, there was a hashtag Ireland, and you could apply to, and you went on a waiting list, and you got to run hashtag, at Ireland for 24 hours. So an abortion rights activist put her name down, got hold of Twitter at Ireland, and tweeted for a whole 24 hours about the impact of the abortion ban in Ireland. We had another time when we had a politician say out loud that he was uncomfortable with legislation without a 3-day wait. So there was a campaign where people made him cushions, handmade him cushions, and posted them to him, and he was inundated so that he might feel more comfortable with the situation. Yeah, well, there was another time when a giant banner which said repeal was unfurled from the Rock of Cashel, which is a really famous kind of historical site in Ireland, and also from Spanish Arch in Galway, if anybody has been to Ireland. So visibility and the messaging is like being on the same message. So I have heard people say in the US they need a repeal jumper, they need something that is the same. I mean, you had the green bandana in Latin America, but something that unites people in the same message. Civil disobedience and visibility for me are the two big things.
Creative strategies. I think that the most important lesson for me of what I learned from the fight in Colombia is that you create your strategies targeted to your audiences, right? So you have an audience that is completely opposite to your beliefs. And this audience is already lost. Like no matter what you do, you are not gonna change the mind of a person that thinks that there is a human being in your belly when you are getting an abortion, you know? Then you have the other part that are the ones that generally support our cause and that are part of our cause. And I think that generally we are very good in making strategies for that kind of audience, you know, like our messages, like to empower our lines, to have like more activists that are empowered, that know more. That audience, I think that it's very good. But in between, we have we have a world and an audience like that an influencer in Colombia, a very well-known influencer in Colombia called the vanilla audience. And the vanilla audience is the audience that you want to get, you know, like, and this audience is the audience that you need to really be able to map to be able to create creative strategies for them. And who are them? No, like, the Catholic person that doesn't know how to stand with these matters, the younger boys that don't know what to do and or how to express themselves in this fight. Who are them and how can we do to get to them? I think that is more like my advice. Yeah.
Thank you. Let's take some questions from the audience.
Hi, I have a question on the role of physician advocacy, just following up on the question that you asked earlier. It's mostly for, is it Eveline? Is that how it's pronounced? Okay. But wondering if others have things that they can weigh in on as well. I've done field work in Kenya, so I'm more familiar with the Kenya context than I am the other places that are represented here. But I know you mentioned that you don't have a lot of physician advocacy help in Kenya. I'm wondering though, with like HPV and the huge campaign to sort of try and eradicate HPV and cervical cancer, with cervical cancer is the #1 cancer killer of women in Kenya. So this is a very big deal. I'm not saying abortion isn't also a big deal. I'm just saying this is an issue that a lot of OBGYNs in Kenya I know are really focused on. And then also with the HIV epidemic in Kenya that I think is more rampant than it is in other parts of the world represented here. I'm wondering if that presents a challenge for you to sort of connect with OBGYNs on this issue because they're focused on something else, or I wonder if you see that as maybe an opportunity to try and like provide some synergies, or if any of you in other parts of the world have sort of dealt with any of these like competing interests as well.
Yeah, thank you. I think just to state, first of all, that even HPV is contested by the anti-abortion groups because they say that is being used to promote, to over-sexualize adolescent girls. And so they have actually waged a serious war on HPV vaccines in the country, to the extent that the ministry and WHO and UNICEF just scattered because they caught them unawares. They actually underestimated the power of those people and the misinformation campaign that they ran around that. And so for them, a lot of things have just, they are contesting so many things, you know. And I would say, yes, it's good. I think it's good to have those synergies. What I have seen is even the providers who don't necessarily oppose this, don't want to get into a fight. And so they would rather provide the services gently. In this HPV campaign that these anti-groups ran, one of the things that happened is they went to the extent of doing, they said they did a test on the vaccines and found that they were laced with, I don't know what, that was to, like a contraceptives, and so that these were being given to minors. At that particular point, one of the really good things that we saw is that the OBS-GYN Association actually also did a test and released their own findings that was challenging the finding. These were actually organized under the banner of Catholic doctors. They really ran a campaign, paraded all of their things and their reports and all of that. So when these other doctors, OBS-GYN Association actually also called a presser and issued a written statement challenging and in fact saying that that was not good science, I think that was really helpful, and even went to the extent of reporting them before the regulatory body, and they were summoned. The two doctors that were leading this were actually summoned, and I think there was probably some disciplinary or at least some warning to them. I think that was the one time that I saw medics come together, and that's one thing we have tried to promote, to just tell these other medics that even if they don't want to be regularly speaking in support of these issues, when they see their colleagues, use bogus science and try to confuse the general public, the least they can do is clarify and issue statements that these things are not truthful.
I have just a comment again about just telling stories and also physician advocacy, which I think might be actually as powerful as individual patients telling their stories, which is worth a lot. But I think physicians and or whoever, nurses, nurse practitioners, I don't know, see all of this in a different way than an individual patient who's gone through maybe their own journey on this that oftentimes they didn't even know they'd have to go on. So it's sort of sometimes a surprise to them, right? But it's not a surprise usually to people in healthcare. And I think I heard a comment by Kamala Harris when she was speaking, in something, and I guess she was challenging something that had been said about how maybe the other side was not correctly speaking about this topic, and maybe they should do better at helping people understand how they can support women and all that. And I just loved her comment when she said, well, where you been? Where you been? And I related so much to that because I thought all I see for decades and decades and decades is mostly female practitioners, but not only at all, months and decades after decade dealing with, women who are trying so hard not to get pregnant, dealing with all the bleeding and the cramping and the headaches and the bloating and, all this stuff for years and years and trying so hard to do what they can. And we are the same ones who a patient will say, you already know, and you've been dealt with them, they were pregnant from a rape, and in no way will they have an abortion, or they have a very anomalous baby, in no way will they have an abortion. Okay, we're the same ones that hook them up with a social worker, hook them up with a counselor, try to help get, rental aid, the same ones people said, well, you can go to these emergency abortion centers and get maybe, what do you call those, car seat things? And I said, what, one car seat? I mean, we've got all that. We give people car seats in healthcare. We help them get a breast pump. What do you need? If you want to adopt, a baby out, fine, we'll deal with that too. So I think sometimes people, or the other thing is if you have colleagues or nurses who don't want to get involved with abortions, that's fine. We all work together. Those who do it help. Those who don't, whatever. It's not that there are not plenty of issues, but I think the public doesn't quite understand how a lot of this stuff has already been worked out and we're doing it. And one other thing, in terms of, I've been bugging number of my colleagues, which I don't know anybody in the South who's doing this, but what's really dangerous now is it's worse than 1970 before Roe v. Wade. It's much worse because medical people are scared now, very scared, and they won't provide services even on stuff that used to be not controversial. An ectopic pregnancy, not an issue. A miscarriage, a blighted ovum, all these different things, not an issue. Even ruptured membranes, she's starting to get septic, she's starting to bleed. Even with Catholic hospitals, we'd, move the patient out to another hospital. It's just an ongoing part of healthcare. It's nothing new or unusual. But now I'm hearing these crazy things where people are not even being admitted because they're being told in ERs, well, there's nothing we can do. No. I said, no. You can admit that person, and you can, if you have to. Okay, let's say you're not going to transfer her. You're not going to give her, or not going to terminate the pregnancy. Or in some cases, in our past, she'll say, no, I don't want to terminate. Okay, just give it a little while. You give it a day or two. We'll see. It's a matter of time. And usually, when they realize, oh, I'm going to lose my job laying in this bed, or I'm going to lose my marriage. I got 4 kids at home. They don't have any care. It's only a matter of time before, generally, they'll, come around to the idea of terminating. But let's say you're in these states, they're not admitting some of these patients. And so people are going through that craziness of delivering in a toilet when they're 18 weeks, 19 weeks. Bizarre. It's bizarre. It's inhumane. And I feel like, and if they're bleeding, people don't realize how much a pregnant uterus can bleed. You can die, but what does it mean to say, well, we'll allow these things in a case of like a maternal, her health is at risk, or her life? Someone so beautifully said, a healthy female can put up with a lot of unhealth, so to speak, or instability until all of a sudden she can't. Her body will crash very quickly. And I mean, how many units of blood before you call that a risk? 2 units of blood, 4, 8, 10? You could just keep going. It's such a thing that's not discussed enough. So I feel like doctors have to tell their stories, and maybe in line with patients.
Caitlin, can I ask you to respond to that?
Yeah.
In the sense of, have things gotten, is the situation, in fact, in a way more perilous now because there's so much attention to,
absolutely. Yeah. I mean, I think about, for example, my own state, and not very far away, where hospitals would say, we'll provide a compassionate early delivery. What is a compassionate early delivery? So you're inducing labor because of, a fetal anomaly, for example. That's an abortion. And we'll just call it something different. And so we won't do the, state mandated consents. We won't worry about gestational age limits. They skirted around the laws in many ways, just to avoid the perception of performing abortions. And now that has gone away completely. And to your point, I had a patient who had a molar pregnancy, which is a precancerous pregnancy. Because there was a fetus with a heartbeat, she was expectantly managed for 10 weeks until she almost died. And they won't even, refer them to us. So I think absolutely all of those things are happening. People are being sent away. The stories of people delivering in toilets and then being prosecuted for, fetal remains, et cetera, et cetera. So yes, I think it's incredibly important for physicians to tell their stories, and to do it along with people who are experiencing abortions, to ensure that their voices aren't silenced either.
Expand on something that Caitlin just said. I think folks in the audience hopefully know this by now, but part of the issue is that physicians are being put in a truly impossible situation. Part of the center's litigation in Texas was specifically to get clarification on what the exceptions were. And they're written so vaguely, but also so narrowly that they're meant to scare physicians out of providing care that they should be providing. And one thing that was really striking, and that we keep seeing over and over, we see this in the aftermath of the 2 women whose deaths from untreated, incomplete abortions in Georgia just happened is the way that both the government and anti-choice groups are in turn blaming the hospitals and the doctors and saying this isn't because of us, this is medical malpractice. They should have qualified. But then when we're actually in a courtroom and ask for that clarification on the record or a judgment that clarifies that these different things do qualify for abortion care, they're completely unwilling to yield that ground. And I think that just speaks to the position that providers are really being put in, where not like just to clarify that the penalties for them are loss of their license, they are imprisonment, they are civil penalties that would completely put them underwater. And so I think just to, I think it's really dangerous territory where the response of the state is to demonize providers who are doing their very best to administer care, but are truly put in an impossible situation.
I know that there were questions in the back. Yes.
Oh, okay. I'm sorry. Hi, my name is Sophia. So abortion is going to be on the ballot in a lot of states in this upcoming election, which is very exciting. But a lot of these ballot measures have different criteria when it comes to what's actually becoming legalized. I'm from Ohio, so we just voted abortion to viability, which is also on the ballot in a lot of other states, but that means kind of nothing. And also, I think as we've heard from different countries, there are different standards and different laws that are being passed. How do you negotiate that? How do we decide what our ultimate goal is? Is this just the first step? Are we screwing ourselves over in the future because we've dreamed too small and now we've trapped ourselves in legislation that is not providing enough access? Where are we going?
Can I just say that this was a big debate in Ireland? The dream big or look for the incremental, take every small victory as a win. And ultimately, it was the dream big that worked. So dream big.
I would like to have an answer for that. But I can give you some of my thoughts that I don't know if these are the right thoughts, but this is what I have been thinking about. I think that we need to be very careful when it comes to change laws and even constitutions around these rights, because something that for us today is a win can be something that can put us in a very complicated situations tomorrow. And a specific example of that is, for example, France including abortion as a constitutional freedom in the Constitution. We have celebrated it, of course, like a huge win, and I have been celebrating it. I was invited to the signature of the Constitution, I was there. So we have been celebrating it. But the reality and my thoughts around this is that we don't need to have abortion in a Constitution in order for abortion to be a right recognized and to be a right that needs to be a service that needs to be delivered for an obligation to exist for the government to deliver abortion services. You don't need to have abortion in the Constitution because you have already fundamental rights in the majority of the constitutions of the world that already provide you the right to access to an abortion service. And if we are putting the stand this high, like no, right now, we are going to include abortion in all the constitutions worldwide, that is going to be very complicated. So this is not answering the ballot question, but what I am trying to say here is that we need to be very careful on how much we really need to regulate this, because that can be very complicated in the future.
It depends on the country. Generally, these basic human rights are not recognized in many countries. That's why some countries need to put this into constitution. Because usually our opponents answer us that there is nothing about abortion in the Constitution. It is not allowed. If it was allowed, we will put this into constitution, for example. So, you know, we know that these are basic human rights, but they didn't recognize, they don't recognize these rights. Maybe it should be stated just directly, abortion is a human right, but it is never stated in no international statement, document, recommendations. It was reproductive health and rights, not abortion. And still on international level is a problem with this, because I never saw the word abortion. And during the negotiations, mostly states, representatives of the states, want to exclude the word of abortion. They just want the access to health, reproductive health services, but not including abortion. And still is a huge fight on international level, not only on countries level and regional level, but also on international. So, you know, as I said, it depends on the country and on the situation. I don't know about the future, but I know that fundamentalism is growing. They have money, they have weapons, they have everything. And I'm wondering why, for example, American fundamentalists just secure and help Polish fundamentalism. I don't know why, for what. But it is known. They attend lectures to the United States. They receive money. They receive support, publications, just everything.
Can I say something about that? Because I understand and I agree in the basics of what you are saying, but my concern is that, and being from the legal world, no, is that there is this conversation also in constitutional and international law around if there is something that it is not written in the text, then that the court has interpreted it as a right. Is it a right or it isn't? No? And for me, we need to fight for the recognition of the progressivity of law and the power of interpretation of our judges and our legislators, and the fact that law lives, and it lives with society, and it grows with society, and we need to continue to fight for that. And because if we don't do that, then we are gonna lose that power of interpretation also. So, and that power of interpretation can be also, and I am not sure that I am right, because that power of interpretation can be used also against us. No? So that is why at the beginning of my answer, I was saying, these are my thoughts. I don't know if they are the right thoughts, but I think that we need at least to think about it, like to really think about it. Yeah.
It seems, and it
to
seems,
predict the future.
Yeah.
You know,
it
but
seems also that part of what really, I think, surprised people that came out of the first morning session was Caitlin saying maybe it shouldn't be. Maybe the optimal is no law.
What comes out of, that discussion of particularly the Ohio ballot and now the one in Missouri, that there's a lot of infighting about whether to approve these or not. The answer is that people are going to die either way. So do you, save some, right, negotiate with them for these exceptions so that you can try to save a few women in the meantime, or do you let them put their total bans into effect and see what happens? Show them the true outcome of these laws, and women are going to die, and then maybe they'll understand, and maybe we'll be able to get to where we want to go. But if you put in these compromises, then only the most vulnerable people will die, right? Only the most vulnerable people will suffer. And so the question is, do we create a world in which we're protecting everyone, or do we create a world in which we're protecting some? And nobody has the answer to that.
I think There's two things I have to say about the referendums, and I think it's just really interesting that makes this a much more complicated question, right? Because when you're working through a legislative channel, you have a finite pool of people that you know will be voting, or you know that they won't be voting, that they're going to intentionally be absent for that vote. And so it's much easier to understand like what people's sort of red lines are and sort of what things they want to make sure are included and what things they don't. You know, you're negotiating with a caucus generally, and so there's really clear parameters on it. Whereas with a referendum, you're really gearing towards voter turnout, and you're really gearing towards people being excited about it and really, you know, invested in what the outcome is. And it makes it much more difficult to figure out, like, what is that? Like, what does that look like? What gets people excited and motivated and will make sure people actually come out and vote? And I think that that just makes the question all the more complicated. I don't have answers to it. I will say, though, every time that abortion's been on referendums, it has succeeded. So there is, you know, that evidence around dreaming big and really going for it all while you've put in all the effort to make this happen. I had one other thought related to this. Oh yeah. But the other thing is that this is also what troubles me about referendums. And this is, they're what we have, and they're so important, and they're so valuable, and I don't want to undermine their value in this. But in other areas of the law, we don't let the democracy, we don't let the majority determine how people are able to exercise their rights. It's just not the way that the legal system works. And it is very fortunate that we have referendums to pass greater access to abortion care in the US, where, you know, voter suppression has also created situations where the legislatures are not representative of what the people in a lot of these states want. But also it's so shameful at the same time, right, that this is the pathway instead of the courts recognizing this as a civil liberty and as truly a fundamental right that people have.
Just on the Irish situation, the law was very much a part of the victory, but not politicians. Even politicians who called themselves feminists, even politicians that claimed to be pro-choice, they let us down in Parliament because they sided with the party line over women repeatedly, shamefully sometimes. So absolutely, I think in Ireland, the legal system and the, you know, particular cases were really important. But I think for several years, people put their faith in politicians who said they were pro-choice, voted them in, and then nothing changed. So what worked in Ireland was having that boots on the street, so that even when things were being discussed in Parliament, there's 10,000 people outside chanting. It's just, I hear people talk about your upcoming election, and a bit of me is going, you know, be careful. Don't think that, you know, individual people will change this. This has to be a mass movement from below.
Yeah. Another couple of questions in the back.
Thank you so much for sharing your expertise. My name is Kwafan Howard. I'm a PhD candidate in sociology here. My question is about how you would characterize the so-called the opposition, the neighbors, you know, that we're like against, right? And how those movements and coalitions have changed over time in like throughout your career and experience. And Ms. Fitzsimmons just mentioned right now, right, like about the alignment of like these feminist voters who still follow party lines. In the US, that's very much you know, something that happened, you know, that was built up, you know, the way that now we cannot really imagine a pro-choice Republican, where like that wasn't really the case, even back to the 90s, for example. So I'm very curious to hear, especially across national contexts, what the opposition looks like.
I think in our context, what I would say is we have seen them change over time, and the change is in how they organize. They are more connected globally. They are learning from each other. And I can actually say that a lot of the tactics that we are seeing them testing in Kenya are tactics that they have already tested in the US. It's the same litigation, the same cases, in fact, framed in the same ways, the same prayers in court. They then bring them to Kenya, they test them in Kenya, and then launch them in other parts of Africa. So using Kenya more as a launch pad. But it's also in the way that the message is framed. I was I was very shocked to learn, for example, that I think it's in Ireland also, where there was a framing of this is a Western concept, referring to abortion as a Western concept. I would have thought, because that's what they sell in Africa, and I thought it was more of a global north and Africa, but it's not. I don't know where the West is anymore, because it's all West. I don't know whether the US is West, or if Ireland is also not the West, I don't know where the West is. But it's really the same framing that they're using. It's the same information, and it's the same actors. And so I think going forward, it's really important that we are also, approaching this from a very transnational way and learning from each other and knowing so that we don't have to reinvent the wheel. If US have already pushed back on some of these things and succeeded, I just need to know what it is that you have done and then customize it to my own context. And I think the other things is, when it comes to framing of messaging around religion, we have really benefited, for example, from Catholics for Choice, because they frame in a way that speaks to the religious body. So for me, it's understanding all of those things that are happening is critical for us as we go forward.
I think another way we've definitely seen anti-choice groups sort of transform in recent history is also sort of moving into human rights and multilateral forum in a very intentional and very real way. So we've definitely seen like the appropriation of human rights frameworks, of human rights language around, for example, the right to life is a great example of this. And also their interactions with multilateral forums to ensure that there's not progressive political language in United Nations and regional human rights bodies around sexual and reproductive health and rights. And that's been a really intentional strategy of really trying to co-opt those spaces, trying to co-opt human rights spaces, trying to co-opt political spaces to roll back abortion rights in particular, but not only abortion rights. I think that that's the other important thing, is the connection between these anti-abortion forces of also being anti-sexuality education and being anti-LGBTQ rights, which is a really, really important thing we're seeing, particularly in multilateral and global forums.
I think that our speakers have been tireless and amazing, and now it's time to give them a round of applause. So thank you so much.